Started. We just can't vote on anything yet until we get a quorum. We got another member on the way.
Bill, where's Colin?
George Weems Memorial Hospital Board of Directors meeting. Our vision is providing quality care close to home, May 28, 2026. Let's call to order. We don't have a quorum yet, but we got another member coming. Next item is public comment. Do we have any public comment? We can't vote on approval of the minutes yet. So, Mr. Walker?
Yes.
National Hospital, well, we'll wait on that. Employee of the month.
Yeah, let me talk about Employee of the Month here. Good morning. The Employee of the Month was Lily Mills, and Lily Mills works in our dietary department. She's been with the hospital 54 years. She worked at pretty much every position at the hospital here, and so we're very fortunate to have her. But I also want to highlight three other members of our hospital. Jean Roberts, she's been with the hospital 47 years. She's working in our lab department. She's doing a great job. And then Mary Brown, she's been with the hospital 45 years. She works in the dietary department. She's the dietary manager. And then we have our materials management manager, Glenda Wilson. She's been here for 39 years. So these are some individuals that really have dedicated their lives to Weems Memorial Hospital, and they've seen, the transition of the hospital in for many, many, many places. So I just want to highlight them while I'm highlighting the Employee of the Month. Thank you.
I think that's wonderful. Let's give them a hand here. Okay, we do have a quorum here, so we'll go back to, Kristen, we had to hold off. We started the meeting. We can start the meeting, we have to have a quorum here to vote, so you make the quorum, okay? I'm not gonna mention that you're late, but I wouldn't do something like
My
that.
dog got out, ran from me. She thinks it's funny.
I know how that is. That's an emergency. Next item is approval of the minutes. Do I have a motion to approve the minutes from last
Motion.
meeting?
Second.
Any discussion?
No.
All in favor?
Aye.
All opposed? Okay. Next item is EMS transition. We got Mr. Lewis here to talk about that. So he's kind of running that for the county. Louis, you want to go ahead?
Hey, how's everybody doing?
Good.
The transition's going pretty smoothly. We have one more big ticket item that we're hoping to get word back today or tomorrow from. DEA license. There were some recent changes in the laws that's caused some complications with it, but I believe we've got that taken care of, so we should be hearing today or tomorrow. Monday will be the full transition, as long as the DEA license goes through properly. So everything's going pretty good.
So
I don't have a big presentation or anything.
what are we saying, June 1 or?
June 1, yeah.
Okay, well, is there anything we can help with? Has everybody been helpful? And
Everybody's been helpful for everything we need, so. And there's
we got
not
a
really
lot
a
of
whole lot at the
professionals.
moment. I mean, like I said, that licensure with the changes in the statute and law has caused some hiccups, but other than that, everything's been really smooth.
Do we have a committee or somebody that's going to sit down to unwind the financials between the hospital and the EMS?
The financials as far as,
Well, we've been paying for a lot of things like the oxygen and other services that we share, so we need to unbundle or disconnect some of those services.
oh, we are. Well, we've already got like for oxygen, for example, we've already got a contract with Air Gas. There might be a few things until certain things get set up, and we'll just have to do some sort of agreement to pay for the things that we still use, but that should be, I'd say no later than July. The only thing I can foresee that we might need a little bit longer, because I went through this in Wakulla, is when you get the new DEA license, sometimes it takes some time before you can order the drugs. So we'd have to get that DEA form 222 to do where y'all sell it to us, essentially. That's a possibility, but it might go smoother than I'm expecting. I'm just running
Right.
through situations in my head and trying to be prepared for it.
So if we have that kind of a situation, you would just reimburse us, we'd
Yeah,
place the order and you'd
yes.
reimburse. I mean,
Yeah,
that's
we'll
what we
do
would do,
that.
right?
Let's-
Yeah.
We don't want any interruption of services.
No.
Louis, is the staffing gonna be about the same as it has been with two
Yeah, I think
ambulances,
it's-
3 ambulances? What's our, just generally speaking?
Yeah, it's still gonna be the Appalachia, East Point, and Leonard, with the captain on QRV.
Okay.
So services are gonna remain pretty much how they've been, so there won't be any disruptions or anything.
Okay, all right, okay. Anybody got any other questions?
And I just want to just, thank Louis and, for the partnership and, working real hard to get this transition in place here. I think it's going to be good for sustainability for the EMS team, really moving into the county. So, we want to make sure that we still have that great working relationship, that we built, when Louis was the director here, between the hospital, EMS, and our clinics. So we want to make sure we continue that.
I do want to apologize. Christian couldn't be here today. I was wanting him to come to introduce himself. With just a couple of days left, he's got his hands full. We're going to try to get him here at the next board meeting so he can introduce himself and everything. And there's still going to be a close working relationship between EMS and Weems, both medical, so it's always going to be close. And as things settle down, he'll be reaching out a lot more to everybody.
Yeah, I'd like to see this, let's still, like if we have little cookouts and stuff like that, I think your folks be invited without even hesitation. We need to keep it real close, interworking together, and that's gonna be the easiest thing to do there.
Agree.
I don't
think
know, I may be able to save on food, Duffy.
Do what now?
I may be able to save some food.
So,
But also, I want to, James Osteen, I just want to stand up, James. James, stepped in. We just want to thank James for his service, as the EMS director, prior, before
Right.
we move on. But, thank you, James. Greatly appreciate you.
good job.
What you
Thank
did.
you.
Good job.
Thank you,
Very good
James.
job. Thank you, James. Thank you.
All right, thank you,
I
Lord.
don't have anything. Anybody got anything else? Looks like it's simple.
Well, if y'all have any other questions in the future, just don't hesitate to reach out. I'll still be involved probably for a while.
Louis, if you need and we have the subcommittee, finance subcommittee, so if you need to reach out to us, we meet like twice a month, so.
Okay.
If, we look at all the outgoing pays and pay bills and everything else, so if you want to lean on us to work through some of that transition, we'd be glad to step in and help.
Okay, we really appreciate it.
Thanks, Lord.
Okay, thank you.
Susan's out this morning. Susan Courtney is not here this morning, so we'll.
Yeah, we got graduation, I think.
Yeah.
With
It's a
Courtney.
rough morning.
Yeah, it is, yeah.
Rough morning.
And one thing also, we really want to give thanks to all of our children that's graduated from high school. There's been a lot of activities this week. I've been involved with a few murders. I've been involved with most of the ones I've been there. But we want to thank all of our young people that are graduating. It's huge, so.
Okay. Okay, let's see. Mr. Gibson.
Good morning. How we doing?
Real good.
Been a bad week.
All right, give y'all a few updates. I've been up in Atlanta area doing graduation with the grandkids, so mine's gonna be short and brief too.
Understand.
June the 1st, we're gonna have the new ER nurse call system set up in the ER. They're coming to do that, and that's through a grant, so no money out of our pockets. They're also going to put a call button in the CT room for emergencies in case they have a problem with the patient in there, and they can page that and they'll come and assist. Andy from GE, he continues to work installing the CT equipment in the CT room. EEI, our contractors for that room, they've completed their punch list that we've had. I've been talking to Gary Gargis. I've talked with him. We had one item on there that we need to have our fire plans updated because we removed 2 sprinkler heads and moved a horn strobe that was in the control room. So when you move that stuff, you have to have new plans drawn up. So our plans were from 2010, so we needed an update. We hadn't moved anything till then, but I've been in contact with him to do that. I have the direct TV contractors there. We've put in most of the devices. They'll be back today to finish up stuff. We have found that some of our TVs, the USB ports where we plug the device in to receive the channels, they're not working. So we're going to have to purchase a few more TVs. And Timothy, the head guy with the direct TV, he's told me a few TVs that we should go in and look at. They're inexpensive, and I'm going to get with him today, and we're going to look at that and see how many more we need. I think it's about like 7.
Okay.
But yeah, but anyway, got to do it. But the pictures that are coming in now, they are crystal clear. It's amazing.
Well, good. We need that.
And our patients are going to have like 47 channels to go through. They're going to have all the local channels. I already checked that out. It's the first thing I did.
This is customer service, right?
Yep. Yeah, it is.
It is, yeah.
And
Great.
so the big thing, the generator project, I've been in contact since we had that approved and everything. I've been in contact with Gary, Mike Cates, Matt Taylor at Ring Power, ACF, who had the generator that the county purchased from, and also Dave Rice with BGN, the contractor that installed the generator. I'll have more for you. Hopefully by this time next month, I'll have some kind of timeline. I'll have everybody kind of coordinated, and we can, have a better kind of timeline of what we're going to do. We've kind of talked it over probably 6 months, maybe longer. So we try to get everything together. 'Cause I know
Is it
the-
still a month, every month you have to do a load test on that generator, a quarter or a month?
Every year.
Every year?
Yeah,
this
the
year,
load
okay.
bank test is yearly, and they come, they do a fuel test. They do the whole thing then. Yeah,
Okay.
yeah.
And then every Thursday we do a check.
Every Thursday it runs. Yeah, it runs about an hour every Thursday.
Oh, okay, just a
Yeah.
run, not a load test, right?
Right, right.
And you let everybody know you do it during lunch or something where
Oh,
nobody's,
they
you let
already
them
know.
know.
Lab is the biggest one because, we still have that little twitch in that old generator. It tweaks the lights every now and then.
Up
So,
until 1 o'clock, yeah.
yeah, so I've told them, I said, hey, cut your lights off if you can overhead so you're not strobing. So, but it's it'll get better. And this other one's going to be is a lot quieter.
Is it?
Yeah, yeah. So, but that's all I got for you this time, unless y'all got something else y'all need or.
Anybody got anything?
No, sir.
That generator's wonderful, y'all. That's
Yeah.
that's something that's overlooked, and it's, I've been wanting it since I've been on the board, I've been,
Me and you
on
both.
that.
Okay. All right.
Well, hurricane season, so we want to make sure that we prepare for
yeah,
that.
absolutely.
Anything, a
Craig.
lot of stuff, not
Yeah.
just
Don't
hurricane
speak it.
season. So.
Yeah,
Yeah.
they'll be here in a couple of months to do all that testing.
I want
and
to tell you,
everything.
Craig, you walk into the hospital and the new floors, the new this, the new that, everything looks so much different
It does.
than
We're getting
maybe
there.
2 or 3 years ago. Yeah.
Dave and I, we've talked, and we got a lot of plans to move forward with a lot of other things too. I've got David and I'll get together either today or tomorrow, and I've got a quote to finish up our patient rooms with that flooring. And I think there's enough money left in our grant to finish that. So we're gonna move
In the
forward.
bathrooms too, we got.
Yeah, we're gonna do the patient rooms first, and then we're gonna move on out to the halls.
Okay.
Come on down the hallways, and then we'll take our other offices, like lab, radiology, respiratory. Well, radiology already has theirs, but those other offices also. We'll continue to improve it.
Yeah,
Yeah.
in the chapel, we'll do the flooring in the chapel, but then also our patient bathrooms in the
Yeah.
rooms. So
Yeah.
we
What's
work
the
on that as
progress
well.
on the CT there? That's coming along good?
Oh.
On the what?
CT.
Is it CT, the new machine we're getting in David's office?
Oh, yeah, if you walked in there, you would think, oh, my God. But he's got stuff strode out everywhere. It's taken apart, but he's running all the cables to it, setting
Yeah.
up the control room. Yeah, he's got his work cut out for him. But they've got it all bolted to the floor. The distance to the side was a question, but they've got plenty of room for the stretcher to come in. Automatic doors work, yep, everything's
So what are we
done.
looking at for
Huh?
our first scan?
Generator's got to be hooked up first.
Okay.
That's our big
You gotta get
holdup
the
right there.
generator hooked up to get that, okay.
Yeah.
All right.
Yeah, and that's because the generator, of course, ARCA, Agents for Healthcare Administration, pay very much attention to generators, being that it's hurricane season and stuff like that.
Yeah.
And then we got a couple of issues that they found, ARCA found during a inspection. We'll work that out. But the generator's the biggest thing. Once we get the generator hooked up, I
Yeah.
think then we're ready to plug and play.
Yeah.
Of course, what I mean by plug and play, we can get it connected, but then ARCA has to come back out.
Sure.
Yeah, I think they said they wouldn't be back out until 100% for inspection when they're ready to fire it up.
Yeah.
So they
Okay.
can witness that.
Yeah, and 100% inspection mean, ARCA is saying, when they come out, it means that you can start the next day.
Mm-hmm.
And so basically, they'll give us approval, then we'll turn it on, and
Yeah,
praise God for that.
yeah.
Okay.
Long time coming,
Yeah, yeah, it has been.
since I got kicked out my office.
Since we're on facilities, since we're still on facilities, I'd like to bring it up again. We talked about it last meeting, and I think we have to do something about the lobby. I would really like to see us pull out that glass, open it up, make it more welcoming for people coming in. If I have to make a motion up here for us to move forward with that, I will. But I think it's important that we look like we care about the people, that we're embracing them, we're not holding them at bay like they're at a bodega, right?
Yeah,
Yeah, I don't think,
Yeah.
I don't think,
So-
well, that's something that, we're looking at. I mean, you can make a motion, we're looking at doing that anyway. And so when we begin to make renovations to this building, we got to be very careful how we do it, because we ran into an issue, with the CT room.
Yeah.
So we can look at that, Chris, and
Yeah,
get some
yeah.
designs on how we want to do that, but we got to be very careful how we do it, to make sure that we don't run into an issue. But I agree with you, we can, really, an old building, you want to do a lot of different things with it, but you got to be very careful how you do it, because it's an old building. Sometimes you run into other
It's all
things
tied
that you don't
together
really
there.
count,
Yeah. So
account for.
Y'all are looking at that, right?
Yeah, we're looking
Oh,
at
yeah,
it, and
yeah.
we'll get some
David and I started,
designs.
actually, a week ago, we started talking about it, the ER registration and the ER also. So we're looking at all that because we've got that, going now, and we want to keep it going. So.
And even with that, we just take, like I say, what we learned from the CT
Yeah.
room is just that we got to be very careful how we pull things out in the old building.
Okay.
So we do have, as soon as we find out something, we'll get somebody in there to kind of draw it off for us
Yeah.
and lay it out, and then we'll look at it.
That's fine.
Yeah, but it's going to be more open.
Great.
If you
Thank
look at these other facilities, David and I were talking about it, Calhoun Liberty, prime
Yeah.
example.
Brand new
You
hospital.
walk in, and it's open. You walk right up to the counter, you talk to them.
Yeah.
You go sit down. Their ER, it's the same way. You walk in, and the lady's sitting at a rounded table. You go in, talk, there's no glass, no partition.
Right.
So it's all open. Yep.
Okay.
All right.
Okay.
I'll keep talking about it until you guys get it done.
Absolutely, absolutely.
Thanks, Craig.
We'll keep it going.
Thank you.
Thank y'all,
you.
appreciate
Thank you. We
it.
appreciate you. Good morning, Mr. Berry.
Yeah.
Good morning, sorry I'm late.
I was late too.
My phone was late.
Well, I didn't have a phone. I got a little dog coming home from the hospital, so I didn't have a phone. I knew I'd be in big trouble if I didn't turn around and go back and get it.
All right, the next item is is finance, the CFO report.
Duffy, before we do that, because we had something on the agenda, I know we were waiting. I want to do the National Hospital Week acknowledgements. I didn't do that yet.
Okay.
Yeah, I want to do that. And we may have to do it twice, because I really want to acknowledge, our National Hospital Week, everybody, that participated. We sincerely appreciate all the volunteers and donors who supported National Hospital Week. It started off, with a barbecue on the front lawn. It was not the front lawn, it was near the clinic, donated by the Franklin County Sheriff's Office at Monday. We had Bruce Sisters, coffee break. The treats were donated by the Weems Memorial Healthcare Foundation. Wednesday, pizza luncheon in the cafeteria. That was donated by Apalachicola B Company, Ace Hardware, Up to No Good Tavern. Thank you, Kristen and Mark Willis, for doing that. The staff breakfast, the staff, the managers, help prepare the breakfast for the staff. And next year, we may change that around. We may get the staff, I know the managers want to do that, but I may just have that breakfast brought in, so nobody have to do anything, on that particular day. Friday, we had the chicken cookout, donated, by Commissioner Anthony Kroom. We had Pastor Scott Lally assist him. We had Commissioner Ward come out and assist as well. So I just want to just highlight, the individuals. A lot of people gave a lot and donated a lot, and the time and effort. We had the Big Bend Hospice people came, to help out and assist us. Also, Courtney and I, we on that particular committee. So Doris Carmichael and the group, we thank them for that. But I also want to highlight Colleen Zester. Come on, stand up here, Colleen.
Good morning, Colleen.
Hello.
Good morning.
She's gonna
Yeah. Well, the reason why I want to do this, you all, because this is the first year, well, since I've been the CEO. I mean, and that'll be, April will be 7 years. Wow. But the first year when I began to do Hospital Week, the time that the staff didn't really have to do everything themselves. This is the first year that we had somebody, and that somebody is Colleen. Bill, thank you for helping out. You're the wingman, but
He's voluntold.
he volunteered. He told me.
It's not Bill, it's Colleen's husband.
Yeah, you're right. Well, excuse me, Colleen husband. Thank you for.
Husband knows exactly how that feels.
Thank you for doing what you told to do. But I really want to just, thank them, because this is the first year, that our staff didn't really have to plan everything and do everything. Now, we did have a committee. We thank our National Hospital Week committee had staff that participated in that committee. But we had one person really, Colleen Zester, really coordinated a lot for the staff, really. And I really want to appreciate her with this. We have a card for you, Colleen. Then we have a gift certificate for you as well.
Not necessary, but thank you.
I know, it wasn't necessary, but we want to just give this to you. And we really appreciate you, because, you did a great job. Matter of fact, I think the staff is looking forward to next hospital week. Colleen should be involved. But you did a great job, Colleen.
You do an amazing job, Colleen. You really do, and we appreciate you.
It takes a whole team, but thank you. Thank you.
Thank you. This is, I've seen more interest and excitement around the hospital than I've seen since I've been on the board. Actually. There's a lot of positive things.
And we'll recognize the sheriff when he comes, because he's been doing something special for at least the last 6 years here, since I've been.
When you have hospital week and you got to do the whole thing yourself, it's not much of a, it's just more work on you. So you took the load off and the coordinating and everything, and I made it over a couple of times, and I was a little busy with stuff, but I want to thank you so much. Appreciate that.
pleasure.
Thank you. Let's give her another hand up. All right, next item is finance, CFO report. I believe we have a pro forma for the outpatient physical therapy program, and amongst other stuff.
I was going to say that myself. We might actually get lunch on a decent hour.
We'll blame it on Courtney because she's not here.
Good morning, everyone.
Good morning.
Let me get
Good morning,
my
Bowling.
stuff set up. Sorry about the, liking that it is moving pretty quick this morning. So what we have in the packet for everyone, and there's a few new schedules, but and you'll see notes in your packet that compares the financial performance, for the 7 months and the month ending of April of 2026 as compared to budget. I'm going to speak about the comparisons I do every month compared to this same period in the prior year. So just, starting with the overall performance of the organization, when you look at the 7 months, fiscal year to date, that's October through April of 2026, our consolidated net income finished at a loss of $1.1 million as compared to a positive budget of $79 and a prior year gain of approximately $445. So, saying that differently, the hospital's actual loss for this fiscal year 2026 versus the same periods in the prior year has increased approximately $1.5 million. Now, I'm going to explain, though, through April and April's month's performance and some highlights that we had related to some very positive cash activity. And I mentioned this last month as well, but we've had some very positive cash activity and performance during April 2026. So for April, our gross patient revenue has finished, or did finish up approximately 207,000, which is about 14% versus the same period last year. Again, gross revenue is driven from the services that the hospital is providing. So those revenues were up 207,000 or 14%.
That's cash, right?
That's revenue, that's chargeable revenue.
All right, okay.
Chargeable revenue. Inpatient revenues, inside that gross, inpatient revenues were the main driver. Those revenues were up 226,000 with total patient days for the hospital up 45 or basically 118%. And I think it's very important to call out, mentioned some of this last month, but we have seen the swing bed program, which is the main driver and contributor to these days continuing to increase. When you look at these increases, that entire 45-day increase is entirely related to the swing bed program and the performance it has brought the organization as compared to this time last year. Those days were up 45 days, or roughly 180%. For the entire 7 months, fiscal year to date, the swing bed program is up 183 patient days, or approximately 96%, which again, said this last month as well, that's tremendous impact.
David,
that the
that's,
organization.
I agree, it's definitely what's carrying us, because some of the other areas are down. What do you attribute the increase in swing bed program to? Because you know what? We don't have a person out there like we did a year or two ago that was pushing swing beds. So my question is, what are we doing right?
Yeah, I think, right now, a year ago, we began to say, we need to go back to what worked years ago, which was the looking at the admissions through the ED. So we have more admissions coming through the ED, and those admissions being translated in the swing bed individuals. Although we're still at the connections at the 2 regional hospitals, 4 regional hospitals, we're still making that connection. But years ago, when Weems had a thriving swing bed program, an admissions program, those admissions came through the ED. And so we kind of refocused that, mindset with coordinating, saying, okay, with Dr. Conrad, let's focus individuals that we admit. If these individuals can be moved to swing bed, let's move them. We also have, different nurses that talk with patients that when they leave, the ED, that, hey, if you need to return back here, for swing bed, we do offer that program. And it's more awareness. We get more calls from people that now realize that we do have an inpatient rehab. Swing bed, for the community, they may not know what swing bed is, so we call it inpatient rehab. So we're getting more phone calls as well saying, hey, I heard y'all got a rehab program. I got somebody in Panama City, a pastor called me and asked me about it. So we're getting that kind of, it's more feedback now, even in the community, the particular program there.
Yeah,
So we're getting the word out, basically, and I know, you said a lot of it's coming through the ED, but I know ED revenue's down still.
Yeah.
It's better than it was prior months, but it's still down from what it had been.
Yeah,
So
yeah.
I don't know that we're getting that many more through the ED than we
Yes, we are.
typically did previously.
No,
And I
yes, we
know-
are. We are getting,
I'm sorry.
Courtney's not here, but we are getting, it's a big shift, through the ED, the admissions part. Go ahead, Kristen.
You mean docs are admitting more?
Yeah.
Okay. What are we doing to market our swing bed? I know we have a great Facebook page, but what else are we doing to market it?
Well,
Do we
yeah,
mention
marketing.
it on our Facebook page and our
Two
social
things, yeah.
media?
Yeah, let me add a couple things,
Sure.
and we do have a care coordinator named Lori Franklin, and actually, we're going to ask her to either June's meeting or July's meeting to come and share with the board the work that she's doing. She's a regional-based individual who is working, she's working a lot with TMH, right, to identify patients that are leaving Franklin County to get those patients back for the appropriate level of care. For the first quarter, I pulled up her statistics, what she had shared. 3 of those admissions into the swing bed program here for the first quarter came through those efforts of identifying and working, closely with the team at TMH to bring those back. Those were about 59 of those days is what that equated to. I think it'll be important for Lori to come and share with the board what she's doing, her efforts, and what that really means. And I don't believe you folks have had a chance really to meet her yet. She came last year to the foundation event and so forth, but I think it'd be great to hear her share what she's doing, not to just target and work with TMH, but also with HCA and Ascension and others in the surrounding area that we can now seek to try to identify those patients.
Who's she
Who was
employed?
the latest? Go ahead, excuse me.
I was just going to ask who she's employed by.
Yeah, she's employed, she's actually employed through Northwest Florida Community Hospital, but she is regionally shared amongst the other aligned facilities. So she helps support not only Northwest Florida, but also doctors here at Weems and also at Calhoun Liberty. And she does some work for non-Alliant affiliated hospitals as well. So
Okay, that's
yeah,
great.
she's a resource that her primary task is to identify those patients, to get them back to that level, to the appropriate level of care, back to those communities. And has done a tremendous job, and I think it'd be important for the board to meet her as
Absolutely.
well, and she can share what she's doing.
Sure.
Who was the lady that came and did a presentation previously?
Was that Disc Village he's talking about?
No, you talking about a while ago. I think Lori, did she come, close?
Yeah, somebody came and described exactly what you
Yeah,
just said,
okay.
that they were involved in.
Yeah, I think,
Okay.
I think could have been either Lori doing I don't know if she came personally, but I know Michael Kozar mentioned it. She could have been on a Zoom. We
I
were-
think she was here
She may have been on
personally,
Zoom.
if I'm not-
Okay.
Okay. Yeah, but she did mention
I'll
that.
see her in
But
June,
my real
July.
question is, what about our involvement?
Sure.
The last few meetings, I've got the impression that our personnel have been involved closely.
Yeah, it's still,
Collaborative.
we're still involved. For example, Courtney have nurses that go out there and visit the different facilities, like in the Bay County and Leon County. You know, they'll go visit a facility, you know, when they have meetings, drop different things off to them, you know, maybe some goodies, you know, at those case management meetings there.
Has that been paying off? Has
Well,
that brought people?
You know, Courtney is not here, but I think, you know, with that, you know, that helps, you know, a lot when they see you and you drop something off that is memorable, like, you know, maybe some muffins or some donuts, things like that. But there's so much turnover in that, you know, in those areas. Lori plays a
Yeah.
pivotal role, her and Courtney, in coordinating all of that.
They've been working together for a while,
yeah.
no?
Yeah.
I mean, I think
She's
it's
mentioned
Those
her
case
before.
managers are a key, and they turn that over.
Absolutely.
And John, you just got to keep going and pounding
Yeah.
and going
right.
and keep your name, and I think that's what we're doing, and finally it's catching on, I
Yeah.
do believe.
I think it's
Our name is
starting-
staying out there. It took a while,
Absolutely.
and I think it's some good positive things, but
Yeah. Continue, you know.
don't expect to see the same person there next month, and
Yeah.
their job is to find them folks a bed.
That's right.
Not necessarily exactly what they need, you know, they're supposed to turn them over and find them a bed. So if we can keep our name right up there with everybody, plus, it could be some word of mouth, some positive stuff getting out there too.
I think discussions like this, I mean, we're bringing, I mean, there's multiple things, as David mentioned, that has contributed to this, the continued promotion and you know, awareness and provider awareness. I mean, it's starting to take off, and we've seen these, you know, success, you know, stories with programs like this, you know, in other rural-based communities, and that's what we want to continue to promote. That's why, you know, that's why I really do bring this up, you know, nearly every month about the continued increases that we're seeing within our inpatient activity, just to continue to bring that focus and awareness that this hospital can provide and deliver that appropriate level of care.
I think we don't need to think we've got it licked, though. We're gonna have to keep doing what we're doing.
Well-
I don't
Yep.
think that's going, you know.
Let me add this to it. I think the personal touch of Courtney, the way she has been contacting these other hospitals and individuals is a lot stronger than Alliance person or that lady coming in here and talking, because she has to serve 4 or 5 masters,
Sure.
right?
Yeah.
Courtney serves 1,
Yeah.
as far as the hospital is
Yeah,
concerned.
you need a lot of tentacles, right, reaching out to do that, and that
Well, yeah,
touch is always
that's-
important.
Sure.
And plus, it's a personal touch, because when you get calls, you know, because swing bed, a lot of them don't know what, communities sometimes don't know what swing bed means, but when you say inpatient rehab, you know, and then when people call a board member who call us, or they call me, or whoever, and know that we have this particular type of program here, and the services are good, because we always get positive feedback. And so I think, you know, all of this, you know, we're working with it. I think we're like at 98% over from last year, you know, swing bed days, you know, here.
You're 96%, you're up 183 days. When you look at, again, just kind of continuing on with the financial and overall performance, you look at the hospital's overall average daily census That's patients staying in the beds here at the hospital. It finished April at just over 3. And that's up from 1.9.
That keeps
just under
growing.
2. Keeps growing. And I mention this nearly every month, but I like to mention that because it continues to keep growing. So that's important. When you look at outpatient revenues, though, for the organization, we were up approximately 5,000 combined, versus prior year. ER is in outpatient activity. I know I touch on this every month as well. It was down slightly, 17 visits or 4% versus the same period in the last year. We average about, or the hospital averages about, during the month of April, averaged about 13 ER visits per day. That was up slightly, as we said, from the previous month. And I do want to mention this as well, the April's performance in ER was the busiest. It's the highest we've had this fiscal year to date. So the 7 months fiscal year to date, April's performance was the highest. Previous month was the highest. Then April trumped over that performance as well. So it is, picking up and getting busier. And John, get it.
David, we are still looking about some signage out there, right? We're still
Yeah.
looking at
Yeah,
that.
David's gonna have an update
Yeah,
on
I don't know,
his.
Craig.
Yeah, I ride by there, and
Yeah.
the only way I know it's emergency room back there is because I know it's emergency room back there.
Yeah, we need a sign not only, and Craig, I don't know if Craig left yet or not.
Yeah.
Yeah, well, they're
Yeah,
still,
David's got.
Yeah, but we need a sign not only on 12th, but we need a sign when you come, because some people come to the front, looking for the ED.
I know.
Yeah.
Yeah, we need something there as well. Well, like David mentioned, ER is the highest we had since this fiscal year
Yeah.
here. And of course, we still, try to address complaints we have with ED. I've gotten a lot of positive feedback, this month, from the ED, in particular one position, but particular one that we had a little issues with, but
We'll talk about that later.
Yeah, but we really got some positive feedback from the ED.
What I know David's going to mention later on too about, and Craig touched on it some, with the rural capital improvement monies
Yeah.
and the plans for the ER
Yeah.
that we have coming up as
Yeah,
well.
and, well, while you're up there, it's part of my report, but, we submitted our capital outlay improvement money, and part of that money, we put in an ED redesign, for that. So if those funds get approved, then we can start moving towards that. And it may take 2 cycles of grant funding to complete the renovation, but we do have money,
You get a brand new
submitted.
CT, you get a brand new CT room there with,
Yeah. Let
that's
me-
going to be, and you got a.
You talk about the ED department or the new design. Did the old design have any upgrades for the ED department, or
Probably.
the one that's on the shelf?
No, you talking about the new ED?
Yeah.
Oh, yeah, well, the old design, you talking about a few years ago when they wanted to design to build a new
I
hospital.
don't know how long ago.
Yeah, it's been a few years ago. Yeah, that ED was separate from the ED area what we have now. There was an ED going to the side of the building, the ED with some patient rooms. Yeah, they had a whole new ED design there. But that was a number of years ago, though.
Mr. Chairman, I think we ought to have a meeting or a presentation at some point as to where we really stood with the old plans, where they might fit into where we're headed, and also from TDC, I think we need a presentation as to what they see for tourist participation, because our funding also is linked to that situation as far as tourists come in here. If we've got, the back of my mind, the real crucial point is water quality right now. That's all I'm hearing, is water quality. And if you don't have good water quality, you're not going to get the influx of tourists that you need.
Yeah, let me just add on what he's saying. Okay, it's on my report here, but one of them is that Commissioner Kroom requests that David Bowling and I come back to the county commission to discuss, the new emergency department plans. And so we'll probably focus maybe in July, go to the county commission, and maybe at the July board meeting here, we can begin to talk about that. But he did ask for us to come back with some plans, for the new ED.
Are we going to see that presentation before y'all give it?
Yeah, I think we should bring it to the hospital board first, but he did ask for that. And I'll let him know that we want to present it to the hospital board first, and then the county commission. Secondly, I talked to John Solomon last week, about coming to a board meeting, to talk about, tourism, all of that. So I gave him 2 dates. I gave him the dates in June and the dates in July to see which one that he can come to. So he'll be coming to one of our board meetings, John, on that front too as well.
Thank you.
I think when we're doing this, I think we need to do some long-range planning too, with regard to advertising a campaign concerning the emergency room. Number one, we're staffed with doctors.
Yes.
MDs, which that's a sticking point with some people. Not me as much as a lot, but it's doctors there. Their average experience is how many years? I mean, my goodness. And I think John, I think that's a real good idea too. While we're planning this, we got all kind of new stuff, and I think the TDC could help with some with that too.
They can interject.
They can
Weems
can
in
do
their
it too.
presentation.
And I think tied into all this, we get the TDC and let them know what we need, and I'm sure, because now as far as water quality, I think the hospital, we have a filtration system that our water quality is
Oh, yeah.
Well,
perfect.
I'm not really addressing that, but that's.
Okay, yeah, I know.
I'm more addressing what brings the tourists.
But we need to let the folks know, we have a separate filtration system
Right,
at the
then-
hospital. See, we need to let them know, I'd want to know that,
Yeah.
and because there's a lot of mistrust in the water system, and I don't know if it's valid or not, I have no idea. But I do think that needs to be tied into our plans, and we need to maybe look at before we build something to get the TDC. We don't have to have a new building to let folks know we got a real good emergency room.
That's right.
And doctors.
So, John, I think we need to move
Yeah.
a little preemptively before we build something,
Yeah.
before if we're gonna build something, so,
So John Solomon got the 2 dates, and so once he tell me what dates he can make it in June or July, I'll put them on the agenda for the board.
okay.
Well, we also have the STRAP meeting coming up, which some of these topics can be discussed in the STRAP meeting as far as what we want to do moving forward on our 3 or 5 year plan.
Yeah, that's it.
So, I mean-
That'll be a perfect time and get that out there,
June
but
19th.
I think we need.
Bill, they may not know what
signage
scrap
and-
meeting means.
Yeah, we need some help too.
Yeah, what, I'm with you.
Yeah, strategic planning.
What is that?
Yeah, he was talking about
What's
strategic
that?
planning meeting.
June
What?
19th.
I said, Bill,
Strategic planning meeting.
yeah, Bill was
Yeah.
mentioning strategic planning when he said
I think
scrap.
they shortened it by calling it a STRAP meeting.
Yeah, they probably didn't understand it.
Scrap. As long as you don't call it scrap.
But I think that needs to be kept in mind, and somewhere along the line, I think the TDC would be happy to help us, because
Yeah.
it brings people here, so. We get some new signage, that'd be a good time to have somebody interviewing our doctors, and let them know
Yeah.
what we have here. Now, it's my understanding that our emergency room has anything that you will get in Port St. Joe. Am I correct?
Yeah, we have the same positions
Am I
and
correct,
equipment, but
Barry?
it's a newer building.
We have
It's
everything that you
yeah.
can get there.
It's just a newer building. You look at the numbers when I was talking to the CEO at Calhoun Liberty, she was telling me, really before they built a new building, she couldn't get any doctors to come really work for her too much. They sensed it was okay, but once that new building came up, that ED, I think they went up, what's the percentage,
It's
David?
well over 10%.
Over 10% of visits.
Yeah.
Yeah.
So
15%.
I was thinking about it this morning, we want to recruit new physicians here.
You've also got TMH attached to that name
Yeah.
too, so I think that helped a little bit.
Yeah, but the new building, even when TMH was attached to the name, when it was in the old building, doctors were not running the work there, she was telling me. She said now they're calling her, hey, let me
To
come
come
work
work.
in your new facility. I mean, that plays it plays a role.
Yeah.
Well, we got solid, high quality services and what Duffy's referencing. That's being provided.
What'd you call it? The scrap?
Strap.
I think it's a
Strap.
perfect time to
Yep.
look at
Strap.
that.
That's perfect.
And get it going there.
Absolutely.
Absolutely.
Just a few more bullet points on the volumes and so forth for the hospital. You know, when you look at overall imaging exams, obviously with the ER being, you know, highest month we've had this fiscal year, but overall performance has been trending down versus prior year activity, does present lesser x-rays. But I do want to point out within our imaging, though, we have seen and continue to see and continue to exceed, you know, year to date versus these same periods last year with ultrasounds, CTs, and mammographies. And I think that, again, promoting the services and you know, the delivery of care here. I mean, when you go, like you just mentioned earlier, and go look at the, I know Craig talked about the CT, and it's impressive seeing that room getting built out and designed, seeing where the how the mammo is now, and so forth. And I think, you know, again, these monies that the state of Florida has awarded these rural facilities, and on David's got plans to talk about, you know, on his update about what we're doing for the next cycle. But these monies are truly helping a lot of these communities.
Yeah, these monies are helping. Now, we get some other monies that may help a little, but I really want to say that the CT machine, with the new machine, you know, it will bring more, not only visits, but, you know, we can do more with that. And so right now, we refer out sometimes for certain exams.
So, for instance, low-dose CTs for lungs.
Yeah,
Because
yeah.
that's a cancer screening annually that Medicare
Yeah. So now
requires.
we
It's
refer
not
that out.
really a choice. Most of your patients that are former smokers, Medicare requires that, and it's a low-dose CT, and I don't think we were able to do that
No,
before.
we're not. Yeah, we're not. So with
We
this
should be
machine,
now.
we're going to be able to do a whole lot of stuff with that.
Mhm.
That's really going to bring in more visits.
Again, and that's going to continue to help improve the performance. Our clinics were down, when you look at it from a revenue standpoint, we're down about, essentially flat, but it's down 3,000 versus the same period in prior years. They finished down nine visits, or roughly 2%. So again, relatively flat year over year. We did see the East Clinic did rebound, when I say rebound during April, rebound from the March's performance, and finished up 38. The clinic finished up 38 visits where it was this time last year. The West Clinic did finish down, though, from a visit standpoint. You know, the provider was out of office for a few days, and there was some educational training and so forth that limited the patient activity for the West Clinic. EMS revenues were down about 22,000 versus this same period in the prior year. Total trips, though, did finish down slightly as well, 152. I'm talking total, which is billable and unbillable. Finished at 152 versus 157 in the prior year. As these revenues, again, you know, these were all chargeable revenues that I was referencing, but net patient revenue, which is what we expect to receive for payment for these revenues, our net patient revenue did finish up approximately 90,000 or 10% versus the same periods in prior year. Again, as I've stated in previous months, that driver in improved net is that higher acuity level of care from the inpatient activity that's being provided here at the hospital.
And I just want to add also, EMS had the highest number of billable runs for this fiscal year in April. So they were, you know, it was the highest billable runs in April at 121 compared to what they've been running at 117, 113, 95, and 98. So this last month was the highest billable runs for them. So.
From an operating expense standpoint for the hospital, we were up 116,000 or 10%. Again, overall expenses versus the same period in prior year. Personnel, salaries, wages, benefits was up, you know, with, again, driven from, you know, again, the inpatient activity. When you have higher volumes, naturally some of that generates to higher staffing coverage. You know, overtime, though. Overtime, when you look at, and I want to call out before I jump too far ahead and talk about overtime, I do want to say that, you know, management continues that productivity. They continue that biweekly report out of the labor productivity on how our performance of our staffing is compared to our volumes through May 17th, you know, which is the most recent pay period that we have that's closed. Through May 17th, our targeted FTEs finished at 93% productive. You know, we're targeting 95 to 100%, so just slightly under that. But when you factor EMS as being part of that, and EMS overtime, that continues to drive that productivity down when you look at it compared to overall to the hospital. EMS, again, was the primary driver with overtime, 732 hours in the month, which is basically 77% of the overall overtime of the entire organization. So you can see that does have a significant impact there.
77%, you said?
Yeah, of overall. Yep. So it does have a significant impact, as you can imagine, from that standpoint. Professional fees were up $36,000 versus prior year. That is, again, and the reason why I always want to keep mentioning this, when we brought the ER providers back in-house and so forth versus utilizing the, Dr. Hart's company when it, providing those providers in-house. We didn't do that last year, we do it now. So that does create that variance year over year. But recall, we are billing for those services. Supplies were down year over year. Continued, again, good cost discipline within our supply management and so forth. Continuing to buy products under contract and what have you. Purchase contract services were up. Most of that, though, does relate to the relationship that we have with a third-party billing company. Again, their performance or their fee structure is based on the revenues that get produced. As revenues go up, naturally those expenses will go up. Will go up as well. Other expenses, again, just a quick note there too. When you look year over year, insurance is our driver. I know I've mentioned this previous as well. We've had some insurance renewals and premiums that exceeded what we anticipated in budget, as well as what we experienced in the prior year. When moving on down the income statement within total non-operating revenues, and as comparison to last year, our grants and contributions continue to obviously continue to be delivered to the hospital and come into the hospital. It is exceeding budget slightly as well by $38,000, which is a positive for the hospital. But April overall, when you look at April's performance, it did have a consolidated net loss, fell just short of prior year as well. But excluding EMS, which contributed about $34,000 of this loss, the hospital loss would have been much less.
And you're working off the original budget that was planned,
Yes,
not
sir.
any adjusted budget?
That's correct. Yeah, there's not an EMS adjusted. It's off the original budget, and that is in your packet, and there's notes in your packet related to that as well. So positively though, for the hospital, I know I mentioned this last month that we would see this in April's performance. When you look at the overall cash position, for the organization, despite recording that loss I just mentioned, hospital's cash position increased $428,000 during the month. That was again from 1.7, just under 1.8 million to roughly over 2.2 million in overall cash position.
How much, what is our overall cash position now?
Over 2.2 million.
What days on hand?
Yeah.
We're getting more disciplined.
Right, well,
Okay.
and also the dish monies that came in during the dish payment.
Finally?
We did get the dish payment, 1.1 million. That was received. Obviously, that's the largest cash item, right, that we experienced in April. But that money was from previous state fiscal years. The state was behind. I know the auditor has spoken about that. We had receivables on the books. That's why you're not seeing it reflected necessarily in income, because those receivables were anticipated. However, the cash was a solid improvement in our overall cash position.
Can I ask you a question, Dave,
Yes, sir.
that I probably have asked you before?
Yep.
Other accounts receivable, is that True Bridge money?
That's not true bridge money. That is related to the dish receivables and so forth. We continue, again, what we did get was from previous state fiscal years. Our state fiscal year, we do anticipate more monies that will come in.
So it's not direct patient revenue, so we have to put it down into the other
That's correct.
receivable categories?
That is fair. Yeah, that is exactly it. Patient receivables relates to the receivables that True Bridge is working on behalf of the hospital. When you look at the overall total cash position, total cash collections were up $510,000 versus this same period last fiscal year to date. Additionally though, and Bill, I'm glad you brought that up about patient receivables and patient cash. And I just mentioned about expenditures with our services fees being related to that. When you look at patient cash alone, Again, that's related to insurance receivables and so forth. That was up, it's up 392,000 year over year. So again, stronger performance within the AR accounts receivable and the collection efforts there for the hospital. The hospital's days cash on hand finished at approximately 55 days, which is up from 48 days in the previous month. And again, the previous month did not include this dish money I'm just referencing. That dish money is reflected in obviously this number I just mentioned, the 55 days. And again, as we looked in previous performances, I mean, the timing and the hospital finally receiving that cash is very, very beneficial for the organization. It was delayed and not delayed on anything the hospital was doing. It was statewide.
David, can you, when you come back next month, can you
Sir.
bring with you the effectiveness of the third party, the 2% fee payout, so that we can see how it goes monthly? Because I don't know if the rest of the board members or the public knows that 2%, the better job they do, the greater amount that 2% should go up.
Yeah. It's
Am I correct about that?
No, you're correct. It's a percentage-based contract, and we'll get the exact percentage, what that contract is, but it's a performance, it's as revenues increase, obviously, if that percentage staying flat, obviously the fee will increase as well, if that's what you're referencing. It's going to correlate as your revenues grow.
One other question while you're standing up here, Mr. Walker. What is the relationship between the swing bed and the rehab program?
It's the same. It's the same. That's what we call it. Instead of calling it swing bed, because a lot of people don't understand that, you call it inpatient rehab. It's the same program, just different words.
Do these people actually get, and other than, I get the impression when we use the terms that these people that come in for the swing bed, they're in the bed someplace, in a room.
Yeah, they're in the room, they
Now,
get rehab.
that's being rehab, but what about rehab services that help them? You know, you go into other hospitals, I have recently, and I see a whole group of people going into a room, 3 or 4 rooms, and they're doing this, that, and the other. Do we do that?
Yeah, well, you got physical therapy, you got occupational therapy, you got speech therapy.
And who does, they're not
Which drives
staff
money.
people,
No,
right?
no, they're like.
They're
independent
subcontractors?
contractors.
Yeah.
Contract.
Where's the break-even point?
The break-even,
What's-
we could get into the numbers, how much it costs us a day.
Yeah.
And then how much we make on our swing bed. We get, the last figures I saw, Jason
Yeah.
made.
Well, swing bed program, John, is cost reimbursed,
Yeah.
right? So, again, you're going to get paid what Medicare identifies as your allowable cost. So whatever it costs you, in essence, you're going to get reimbursed based on traditional Medicare.
Okay, I think
Settlement.
that maybe I didn't state it correctly. What I'm trying to understand is the rehab, third-party rehab people
Right.
that come, we have to pay them.
Sure.
What does that cost us as compared if we had staff
Sure.
that did that?
Yeah.
For staff, we kind of broke that out, because usually you have to have a physical therapist, you know, you pay them maybe $100-some thousand a year. And you have to have a speech therapist. You have
And
to have a
occupational.
Occupational therapist with that, and so.
You gotta look at, do you have the capacity and needs to warrant full-time versus contract?
So what we
Right,
have now-
and our volumes today don't support the full-time needs.
Okay,
of
that's
that,
what
so
I
it's
was trying to
Yeah,
get to.
it's not going to.
If we were a full rehab center, we'd have to have
Yeah,
full-time
exactly.
physical
Yeah, so if
therapy.
you're for a rehab center, you can do that.
Right.
But we get a great deal because our swing bed payment it's a good payment.
But it doesn't really, it doesn't really mean rehab per se in a room with some physical therapist,
You
does
know,
it?
no, all of
It
that,
does.
all of that is included.
They go to when we have a gym, they go to the gym,
Yeah.
a small
Oh,
gym.
You got
Here.
activities.
Yes, sir, in the
Yeah, you
hospital.
gotta-
There's
Okay.
a room where
Yeah.
they have a gym and
Yeah.
they take them down to exercise. They walk them in the hallways,
Then I'm
whatever.
all with.
Whatever their proper care plan is for that patient. Some may
Yeah.
not be able to walk, so they may not. So
Yeah.
it's all individualized to that patient and why they're there.
That's right.
And-
So if they're there for a hip, obviously, the care plan is going to be different if they're there for a shoulder or if they're just there for
Stroke
respite
as well,
care or
yeah.
malnutrition or whatever.
Now, does the public know that we have those type of services?
Yes.
I would assume so. That's why I asked about marketing.
Yeah, that's what we were talking about earlier, John.
That's why we
That's
need
why I
to
wanted to
get
know
it
how
out
it's
a little
marketed.
better. That's what we're talking
Here's the
about.
deal.
Here, I'm on the board and I don't even understand it.
But we've been talking about it, and I think we probably need to change the wording, because officially it's called swing bed, but really it's inpatient rehab. Now, in order to have an inpatient rehab or swing bed program, you gotta offer physical therapy, you gotta offer speech therapy, you gotta offer occupational therapy. You can't have a program that you don't offer that.
Right.
So when we talk about inpatient rehab or swing bed, that's what we're saying. A patient can come to the hospital, they can get physical therapy, occupational rehab, and speech therapy. Now, you cannot refer a person to a hospital for swing bed care if that organization don't have those
Right.
3 components to it.
Right.
So you got to have those 3 components regardless to get that care,
Thank you.
okay?
Yep.
All right.
And it's convenient for families that live here, and nobody wants to drive all the way to
And
Tallahassee 2 or 3
we're
times a week to
reimbursed.
see their loved one.
Yeah.
And
we just need to get-
also with Medicare, you get
Yeah,
how many days?
Yeah, really, you get 21 days or 30
21 days.
Yeah, I really didn't want to put our payment method out there, but
Right.
believe me,
Yeah.
one patient would pay
Cost-based,
for nurses in
yeah.
the physical therapist,
Yeah.
occupational therapist.
That's well worthwhile. Good service
Yeah.
to the people.
Yeah,
too.
and that's how the critical access hospitals really can make a positive margin by increasing that particular line of services.
And you have to think, there's no rehab here apart from St. James and Lanark.
Correct.
There is no rehab in this county. This is a huge county,
Well, let me tell you
and
what.
it's needed.
Yeah.
I got a personal story on that. My mother she fell and broke her shoulder. Then what's the first stage where you got around-the-clock nursing over in Tallahassee?
Pain.
No, I'm talking about then, so many days there, and then I'm listening to the case manager, and I want to get her close to me. And St. James it serves a purpose, but it's not good for somebody that don't need to be at St. James. And if I'd have known, if that I had it here, I'd a lot rather been here
Yes, sir.
than at St. James.
Right.
I mean, I just,
And that's very important.
It's a nursing home.
Yes,
Because
sir. I agree.
we've all had experiences with family members, that we were in Tallahassee or Panama City previously, had to stay overnight, because of that. Because the family was getting inpatient or swing bed care really in those areas. So to have it here, the family don't have to go to a hotel, they can come down to the hospital, they can bring the dog, we're friendly with that, because people like to bring pets, to visit them while they're there. And so it's a lot better, people get healed quicker when they're around their loved ones here.
Correct.
You want to kind of cut this, and we got the sheriff here. He's a busy man.
But as soon as David Bowling finished.
Okay, all right.
He's about finished.
Sheriff will be in just a second,
You
okay?
just got cut off by the sheriff.
That's right, that's right. We're good.
Better watch that black hat.
That's right. We're good unless there's any other questions. No, but in summary, again, from a balance sheet standpoint, and I talked about the cash position has significantly improved as far as any type of liabilities and so forth. There's no vendor payables, nothing at risk within the organization. There continues to be positive movement there. We do have, when you see those other liabilities on the books, I continue want to share and update everyone. That is where those grant dollars are setting. Again, as those grant dollars are getting put into use, like David's going to talk about a little later, with the CT work that's going on and the future work that Craig has talked about up here as well, those monies will be released out of a liability status as those
Right.
monies are being utilized. So,
That's a strange way you have to do that.
yeah, and again, and I always want to mention that because I just don't want to give the presence that the hospital, from a liability standpoint. So again, cash overall, days cash on hand, I mentioned it already, 55 up from 48 in the previous month. Receivable days are at 67. That's a good improvement too versus our trailing 12-month run rate of 76. So it is continued improvement there. As Mr. Berry suggested, I will share with the board, that trend of increased revenues from the patient collections from utilizing the company and how that correlates to the fees that get charged as well. And Other than that, unless there's any questions.
Well,
that-
David, I'm
Yes, sir.
pretty encouraged by the cash flow statement, looking at the net cash provided by operations at 406,000. I think that's a positive direction, even though we had a net income loss of 114.
That's correct. And I'm glad you just mentioned the cash flow statement. I mean, I started the presentation, I mentioned there were a few additional slides. We're continuing to add additional comments and commentary in your board packet. A lot of that I'm not necessarily up here reading from and speaking about. It does show comparisons to budget. It does now present a cash flow statement. That way we can see the uses of cash for the organization. We have broken out the operating cash and what we'd say board designated cash as well. So you'll see those items broken out on the balance sheet. You'll see the new cash flow statement. You'll see other comments that are getting added as well. So.
Thank you.
And we'll bring David back to do the.
Good job.
Yep.
Anybody got anything else?
Thanks, Bowling.
Thank you.
Thank you.
Thank you.
So let's switch over, Sheriff.
Good morning, Sheriff. Good morning. Really, it's a great pleasure of the hospital. You know, since I've been the CEO here, you know, for the past 6 years, you know, we have sincere appreciation of Sheriff Smith and his staff for the continued support during National Hospital Week over the past 6 years. Here, you know, they come, you know, they barbecue for us, you know, and if it's not any hospital week, if we need something for the sheriff, you know, he's always there to help us. But I just thought it was fitting, you know, this year that we want to highlight you, Sheriff, and it says, Georgia Weems Memorial Hospital presented to Sheriff Smith and staff with sincere appreciation for your continued support during National Hospital Week over the past 6 years, presented by Weems Memorial Hospital. Now, the sheriff not only take care of us, but he take care of all the other healthcare entities in the county, you know, during that week. You know, they take them food, health department, the different medical offices and places like that. So, Sheriff, thank you.
Thank you so much. Thank you.
There you go. It may be good to get one with the board members.
I was going to say, you want one with us?
Yeah.
Listen, y'all don't get up right yet, because I got the wheelchairs coming for Duffy and for Mr. Barry there. I know y'all need that. You need, well, no, Bill got his electric chair. He's all right.
But I tell you what, once y'all come and Sheriff get a picture with you all.
Well, Duffy takes enough pictures without this one.
I'm like, where can I get a better cast of characters? I'm like, wow.
Here, we need to stand up high here, because you're so tall. That's right.
You come together more.
I got to hold my stomach, yeah, I had to go there. I think you want, come up here.
That's not necessary,
1, 2, 3.
but thank you. Can I get one now? Sorry. Thank you.
Thank you again, All right, y'all, let's take comments.
Okay.
Since we're up anyway.
Good morning.
Order. Let's see. We also have we have the outpatient physical therapy program pro forma. Mr. Bowling, I believe you got some information on that.
I do, and it should be, I believe that was circulated in your board packet as well, so you should see, excuse me, should see the outpatient physical therapy pro forma. I know Mr. Zester has inquired and questioned about this as well, and obviously, as mentioned earlier, with our upcoming strategic plan that is scheduled on June 19th, and while I'm standing here mentioning that, I want to make sure that hopefully everyone's had a chance. If not, please get scheduled with our coordinator for that, with Belinda Minch, so that we can she can do that interview process. I know she's been meeting and discussing with several folks, and certainly our county commissioners, hospital board members, and others that have been invited. I know Colleen Zester has really helped as well, identifying folks within the community that we would want to be part of that as well. So, but related to the outpatient therapy program, you should see in your packet a pro forma. And this pro forma, again, just at a high level, is a 12-month snapshot with a year one total. Obviously, with any startup of any program, you do have a ramping period, meaning that to get to optimal volumes and program awareness, it takes time to ramp up. So in your packet, you do have a pro forma. This pro forma, obviously, with year one does represent an overall loss, but I want to walk through the assumptions that drive that overall performance for the year one. When you look at, and I just mentioned this about the volumes, but the volumes were modeled, after comparable type therapy programs within critical access hospital settings that are starting up. So it is what I would say, and as we did disclose in here, a conservative startup. We do think that this program can and will be able to continue to grow, but looking at the volumes, it did start, month one, and you can see the progression through month 12 of that year, producing approximately 1,290 total visits throughout the first year. Again, this is a conservative estimate. The net revenue associated with that visit activity represents around $113,000 or $87.88 per visit. That estimate on the revenues is again, I want to keep referencing conservative. It is conservative, but you can see the methodology. It's very detailed and disclosed there, the methodology, which overall does include a blended, when I say 87, it does include a blended rate that involves the anticipated payer mix within our community. So it does involve what we would anticipate getting from our Medicare, our managed Medicare products, our Blue Cross, traditional commercial Medicaid, and even some self-pay that could flow through. So
Because we don't really know what the blend would be for people paying through an insurer who had insurance versus someone getting a government program like Medicare, right?
Well, it is, yeah, Bill, it is estimated that is part of that overall blended rate. You can see the detail behind that. So, for example, I'll give you a good illustration. Traditional Medicare is around 105 per visit, Medicare HMO 92 per visit, HMO not modeling what traditional Medicare. So there will be contractual opportunities for us to renegotiate to try to get those rates up to be comparable, if not exact, what traditional pays. So this process does expose us an opportunity really to bring a service like this to the community, but also to renegotiate some of these insurance-based rates to get them higher, which again would pump up more net revenue, which again would certainly help the performance.
Exactly.
Right. So when you look at the staffing model that would be needed, and again, we have that disclosed as well. Obviously, you're going to need a therapist. And we did estimate, the therapist's salary range. You're going to need a therapy assistant in this as well. And you can see how that was ramped up for that therapy assistant's needs as the volume continues to grow. And then even Mr. Berry brought up earlier about speech and even OT-related services. Those obviously would be at a contracted basis and so forth. And there's some synergies there that can be utilized from current contracts, current relationships that's already in place with our in-house swing bed program as well. So, and let me get back to my notes here, but again, a very detailed, what I would say, analysis that is included inside of that. But overall, again, starting up a new program, you got that runway to where, you're obviously, as you staff it, you're not going to be producing the volume initially out of the gate, but you do anticipate that volume growing as it progresses and the program gets more awareness, more marketing, and so forth. So we do think that overall, with us being again a critical access hospital, offering a needed service such as this to the community, having the synergies and already relationship in place with the therapist and therapy companies that helps provide our swing bed coverage, this can be a good option for the organization to look at in providing and continue to enhance care for the hospital. Again, conservative modeling is in place here. So forecasting a year 2, a year 3, a year 4, I think you would see, you clearly see that in month 12, but we would anticipate, with coverage and so forth and renegotiating in the payer relationships, that net revenue number can get much higher.
Don't you think at some point there's got to be a cap on how many visits we can do based on the size of the facility?
Absolutely, and of course the staffing as well, right? So, and we did not, forecast and model that continued out right past that, but there would be to support the full-time therapists, and you can see as this model ramps up, when you get to that month 12 and get to that visit activity, that does warrant that full-time therapy. Obviously, the therapist day one, but the therapy aide or the therapy assistant as well as you get to that 170 or so visit.
I think the need is here in the community.
Absolutely.
We don't have anything around, and I know that even you talked about this, Duffy, that there are certain insurances that do not provide for coverage at certain facilities. And I think I talked to you, Mr. Walker, that our insurance would, we would be able to take anybody's insurance. So if they had a situation where they needed to go to physical therapy, but their therapy wasn't being covered under their insurance program somewhere else, that we would have the ability to provide that service for them with the coverage under their insurance program, correct?
Yeah, correct. And we have only one other individual in the county in Apalachicola that provide physical therapy service. It's individually, Tom Brocata. Yeah, he provides that service here in the county. But with us, a lot of places are limited with the insurances. We should be pretty good. Now we'll, look at our insurances to make sure we're, able to bill. But I think we'll do good here because people got to go to Crawfordville or Tallahassee. If they got CHP, they go back the other way. Now, if you got Blue Cross Blue Shield, you can go over to St. Joe as well as Panama City. But even sometimes St. Joe may have a waiting list, to get in.
Well, some of
I know what CHP does, certain procedures. They're going to require you to go to physical therapy about 6 times. A lot of times doctors say this ain't going to do any good, but before CHP will authorize that. So in essence, you could have 6 trips to Tallahassee or Crawfordville before you could get your therapy right there.
I'll Gulf County or Bay County, because some people go back the other way, as well.
Do what now?
I say either Gulf County or Bay County.
Yeah. And so it's something that's needed down here.
Sure, and I would
lose money, but it's
and I would anticipate, again, like I said, with you're not going to have that much loss as you're going to see early, right? When you start up a program, you're staffing, you're ramping it up. You get to month 12 and pass and into the next year and so forth. I mean, it becomes a manageable service line here, and again, much needed. And again, we're going to work again with the therapy providers that's already providing with our swing bed program today. So again, you're leveraging and utilizing staffing that's already in existence and known today.
Are there any additional fixed assets that we need to purchase? I don't see that, did we put any of that in the pro forma? Because I think there are specific
You may have two more.
machines or things that we need to make this happen as well, right?
Yeah, well, the physical therapist mentioned, and Courtney mentioned it last week, not last week, last month about this. We may have to purchase, one or two equipment, maybe less than $3,000, $5,000. But I remember John mentioned a company in Tallahassee that served.
Play It Again Sports.
Yeah, Play It Again Sports, and Courtney will reach out to them, and Jeff is from that area, so.
Get some used equipment from them?
Yeah, one or two equipment, but it shouldn't be a problem. That's something
Okay.
we'll make work.
When you did this development, is there a ranking of rehab services as far as in what order you should offer them? Or do you have to offer the whole basket at one time? That's question one. Question two is, when you do that, do you have to contract, and if you make a contract employee, that's what I'm thinking about, do you have some idea of what it's going to take to break even, to get away from a contract employee to have an employee in-house?
Let me answer the second one. Yeah, volume is going to drive that decision point.
That.
That's and volume and space and capacity, and not really sure the market would support it currently. But has that been modeled all the way out? The short answer is no on that yet. And you can see in this pro forma, you can see that line item for the contract. You can see the dollar amount, and certainly the need for full-time would be much higher than that contracted dollars that we have in there
So we're
today.
talking only inpatient, right, Bowling?
No,
this
This
would
is
be
outpatient.
Yeah, this is
That's what we're
entirely
talking about,
outpatient.
yep.
So
have that.
does that
This is-
include home health or just in the
No,
hospital
no,
facility?
No, this is
Okay.
a hospital operating department,
Okay.
yeah.
Okay.
Yeah, this is outpatient. We would utilize
Home health.
services.
Referrals.
Yes, home health
Okay.
referrals. We'd utilize services from our swing bed providers, right, from a therapy standpoint.
Yeah.
Right, and you can utilize those providers. So again, this is an outpatient, I'm glad you mentioned that, this is an outpatient rehab therapy program.
Do we know the order of the outpatient rehab services that we should provide, in what order, to bring in the maximum amount on the front
Sure,
end of this?
Sure. As far as in this analysis, no, John, it's not. The service mix, I guess, is what you're referring to. This is just modeled after, like.
So this
like
is generic, you haven't got to the specifics
You
yet.
got to the specifics of say in a service mix shift, what is more higher PT, higher OT, higher ST.
Right.
Got it.
You can't really predict that, Bowling.
Right.
There's no way.
PT, more than more than likely, again, I don't want to speak, and mislead in any way there, but again, it's modeled from a service blend that would be like a like-kind or comparable critical access in a rural setting of what you would anticipate related to services.
Any rural transaction money that would help support this particular program?
No,
Not this
No.
particular program.
no,
We can't tag into that, huh?
no. I'll talk about that a little later. but-
But there is-
Telehealth.
Just thinking out loud.
but there is a huge opportunity, David, to talk about this later
Yeah,
related to that program.
if it was telehealth, it could be a little different,
Can we do it over the Zoom?
And again, we wanted to provide this level of information to you as a board and certainly speak about this publicly, but what we would recommend for this program as we're moving towards that strategy planning session here June 19th, so just a few weeks away from that, this is certainly one of those items that you would want to address in that setting, study it more, discuss it more, look at these out-migration patterns of patients that are receiving this service, that are leaving this community again, and develop that strategy plan around how do we bring this service to this hospital. I think it'd be a great discussion point during that June 19th meeting as well for us to, clarify more on this and what more could, and how much more could we potentially grow this program. So we wanted to give you just a good basis to start with, right?
Yeah, I'd like to
Starting
work on
spot.
how we make it more profitable. That's what I would like to work on.
Yeah. Well, what year 2, 3
Yeah.
looks like.
I
This
mean,
is
you
just
know.
an out of the gate if we wanted to.
I get it, you got to
look
put some
start
money out to
something.
make some money, but it's got to make money down the road, otherwise
That's right.
it's a drag on the hospital.
I think it will.
Yeah.
There's a huge need for it.
Yeah, I think it, once we start it, I think, it'll grow, because there's
Absolutely.
nobody else really around here doing that kind of service with a lot of insurances.
Yeah.
Right.
So I think it'll grow.
Well, educating folks, it's going to be important to go to places, Tallahassee particularly.
Yeah.
The orthopedic center there, you get a lot, and them knowing that the referral could come here.
That's right.
Somebody don't, and I guess we do that through education and advertising, whatever out there. But I wouldn't have a clue, and if they don't know about us, they're gonna send us to Tallahassee. They might try to send you anyway. You know? So, I mean, that's
Take
gonna
a
be real
referral
important there.
Yeah.
I don't know, what, are y'all asking us to?
No,
No,
we're just considering it now.
That's right.
Yeah, we just wanted to bring it up.
Just wanted to bring it up and just share some initial numbers and some initial startup numbers, if you want to call it. And then I think at our strategy meeting here, June 19th, let's really dive deeper into this type of program and look to see, we do recognize it is a needed service. Let's look at how we can make this.
What's your opinion?
It's needed and
So
lucrative.
far.
My opinion so far, yeah, I think it's needed. I think we can, I think you got a great opportunity. to-
It's a
to provide-
low-cost startup.
It's
Low-cost startup, you got a great opportunity to grow a business, grow a service like this for the community. It's needed. It's going to take some work and effort on the referral base, right, to get it to come into the organization, but
Yeah.
I think it's,
I
I think it's a doable service.
Opportunity to be treated at our hospital that would have never thought about
Mm-hmm.
in the past.
That's right.
We could possibly pick up new business. too.
Yeah.
But Duffy's right. I mean, as a provider, we get drawback from insurance companies all the time for certain things. The first thing they want when a patient is surgical or they perhaps might need surgery, the first thing insurance asks for is physical therapy first. That's what they want first. They will start with that before anything else.
Exactly.
Sometimes before MRIs, sometimes before CAT scans.
Exactly.
They want therapy first. So it's a no-brainer. It's a win-win, and it's a guaranteed payment from Medicare. That's what they want.
Yeah, and I agree with that. This is really a low-cost venture. It would create access close to home. That's what we want to do here in the county. And I think it's good. I mean, I'm looking forward to this. So
We
we'll-
just have to get it right the first time.
Yeah.
We only have one
That's right.
time to make a good impression
Yeah,
on this.
yeah.
So we have to get it right.
Yeah, yeah.
From
And
our
what-
therapist, from our
yeah.
therapy assistant, from the gym, from the equipment. We have to get it right the
Yeah,
first
and
time.
one thing about the physical therapy department we have now, our therapist is well-known in this county, because he works also for home health care. I mean, he's well-known. I mean, people really like him. I was talking to a
That's
patient.
half the battle.
Yeah, that's half the battle. I was talking to a patient the other day. They got discharged from the hospital, was in physical therapy, was in the swinging bed program, and I asked her how she was doing. Can I help her? She said, "Oh, you were great." She began to talk about the therapy program. Of course, she began to talk more about the food at that time. But the therapist is very well known here in the county, and so that's half the battle there. And so I think, this is good. It's something that we need to do. Because we got the right therapist to run the program for us. Because like I say, he's visited a lot of these people in the homes already, some of them through home health care and things like that. So thank you, Bill. Great job.
It gets tiresome going back and forth between here and Tallahassee and Crawfordville.
Well,
But you'd
it's
think
it's
that-
costly.
Nightmare.
You
It's a
live
nightmare,
here.
and it is
You live
costly.
It's
You have to buy
costly now,
gas,
it's
lunch.
$4.50 or $4.30 a gallon. I mean, it's costly for people.
When you got to think, it's a 2-hour drive one way. It's a 4-hour trip, round trip, if you're going either way.
If you get a Tesla, then you'll be all right.
Stop it, I
Get the
say.
gas.
Stop it, I say.
Or if you had a golf cart, right?
Yeah, a golf cart, an electric golf cart or a Tesla, you'll be good to go.
Well, I know of mine, they want to schedule me once a week. I talked them into doing it every day for 5 days. 'Cause, I just went up there and got it over with. And copay at the time was $50, so that cost me $250 on top of that, plus the travel and, huh?
You stay up there, hotel costs, et cetera?
No, I got a little place at the beach I stayed,
Okay.
but it was, I think y'all, we gotta, you look at it and we're gonna possibly lose money, but I think it's a benefit for the hospital overall, so.
And the community, yeah.
I think we need to proceed.
More importantly, the community.
David, you've been around a lot of rural hospitals, and you've probably seen these things work very well. And we all know people that have had to travel all over for the physical therapy.
Well, I think
You
so.
know,
and I think it,
It's just wears you out.
Wears you out.
It ruins your whole month.
Especially at your age, huh, Barry?
Do what?
I could say something, or I could,
but
I'm kidding. I'm
hey, how you
kidding.
doing?
But we have seen these programs, like you said, be very successful. We do think it's a need for the community. We do think we can get this program successful. I mean, again, I just wanted to do the initial startup on paper,
Okay.
what that looks like, and present that. And but I do think that yeah, I mean, this is a service line that can be provided here.
And
Good.
you have seen it profitable in other
We have. Yes, sir.
hospital
Yes, sir.
settings.
So how you get it started?
Do we have a big enough space for that gym, where the gym is bowling?
Yeah, Jeff, the physical therapist, he mentioned that we can do it there.
Okay.
You know, he said we can start it there. We may.
That's
have
my
to get-
greatest concern is the space.
Yeah, and we may have to get like 2 other equipment areas, but he indicated that we can start it in that particular space we have now. And you really want to outgrow it. You know, we want to
Yeah, of
outgrow
course.
it, and we'll just have to
Absolutely.
figure out.
We'll have our new building, so it'll be okay.
Yeah. You can take the whole ED. the
Well,
whole-
that was my thought, is if we have a brand-new ED, the smartest thing would be to turn that into a SNF and
Yeah,
Mount Pitch and Rehab.
yeah. There you
go.
The old building.
Yeah.
That'd be the smartest thing to
Yeah.
do.
All right,
No.
next item, let's move on. I like the whole concept, and we're gonna keep working on it, and you'll be doing something, okay?
Okay. Well, that's a good conversation.
Next item is Mr. Zester, Bill Zester, Finance Subcommittee report.
I really don't have much to say on that subject. We looked at some payables, and everything seemed to be the way it's supposed to be. We sent those out and signed off on them. One thing that was brought up at the meeting was that TrueBridge had provided us with about $700,000 in receivables for April. So that certainly helped our April numbers, and some of the cash that we're looking at increases, et cetera. So very positive. They're out there collecting money for us that wouldn't otherwise be collected. So that's all I got to say.
Awesome.
I have a question.
Of course you do.
This is to the board, and mainly to somebody that can research it. I want everybody to come to the pharmacy meetings, but they say 2 of us can't be there. Only 1 of us can be there
Why?
under the sunshine
Yes, you
situation.
can. You have to advertise it as a meeting.
Okay,
That's
only,
all you gotta do.
yeah, okay, when you have a voting issue, you know, preferably only 1 member should be there, because you can't talk among yourself with things that you're gonna vote on. Board members
But we
cannot.
already voted on it.
That's what I was told. That's why I didn't come to the
Yeah.
last meeting.
Same.
Because I was
You told
told
me
I couldn't be
come.
there.
Yeah, because,
And that's what I was understood.
yeah, because you
too.
cannot, now, we can get Michael Schuler, Attorney Schuler to clarify this, but if you got, board members cannot talk amongst yourself on voting items. For example, we discussed the Blue Engagement performer at the board meeting, at the retail pharmacy. We also discussed the engagement letter from Marvin Hayman, which we're going to discuss now. Board members cannot talk about these things because you got to go vote on that. You know, now, if you're not discussing any voting items,
Yeah.
then you can come to that meeting.
Okay, now let me just take it a step further. That's why I haven't participated in the finance meetings either, because that's 2 of us get in there.
Well, they're advertised. The Finance Committee meetings are advertised.
But we're not voting on that, we're not voting on those items in the finance committee. You know, you cannot, and we can get it clarified from Attorney Schuler.
Well, Murtis is there with
I'm
me
confused.
most of the time anyway.
Yeah,
so-
yeah, finance committee meetings can have board members.
Murtis is there.
I know. and I don't
Y'all
wanna-
go if you want to. I'm
That's
not
an
doing
official-
it.
that's an
I'm not
official
doing it.
meeting.
I'm not gonna be in front of a grand jury and all that stuff. I mean,
Okay, that's a meeting, you know, the bylaw states that, you know, you have to have a finance committee, and usually board members are a part of that finance committee, whoever want to be a part of that. Now, we designated a subcommittee for the retail pharmacy. I don't think two board members, because you sunshine laws, you govern by that, can talk about items that you're gonna vote on before the vote, before the
Right.
vote. You
Right.
can't, you can't do that. You know,
Right.
so to keep
That's
y'all out
right.
of trouble, you know.
You gonna keep us out of the meeting, to keep us out of trouble?
Yeah, you got to. 'cause
Pretty
you-
much.
Well,
You'll begin to
just
talk about
need
that.
to be clarified, because I don't like to be the one that says, hey, you can't come, or
No,
something like that.
No, they didn't say that. I'm saying it as a CEO saying, okay, you cannot have two board members discussing items prior to a vote.
And then you update us
Yeah,
accordingly.
yeah, we'll update you, because now with we're gonna talk about the performance. We will talk about two items that we're gonna vote on. You know, we'll get clarification from Attorney Schul on this too. But we're gonna talk about those two items this afternoon, not this afternoon, right, in a few minutes with John, under John's report for the pharmacy that you can vote on. You know, but you cannot, any board member for anything cannot talk about two items, any items that you're gonna vote on prior. You just can't do that.
Okay.
I mean, that's my understanding of it.
So I'll be to your meeting unless you have to vote on something. Correct. If you are voting,
Everything we do, you gotta vote.
No,
on.
no, but you
That's what I'm
can't,
talking
for example,
about. That's what I'm
you
talking
cannot
about.
discuss
I mean-
the performer that the performer that you all gonna vote on right now, you know.
Took place at the last meeting.
It took place at the last meeting. You cannot have that discussion and then go vote on it. That means you colluding your vote. You know, you can't do that.
Y'all, I checked, Mr. Morone. I think Attorney Schuler weighed in on it, and it's just not good practice to have two board people there when, you know, you're gonna go there to discuss the pharmacy, right? Well, there's somewhere along the line, you're gonna vote on something at the
Yes.
pharmacy. That's just the way it is.
But you
Don.
can't, but you
now-
cannot have two items that you discuss like that.
Now, like I said, you can make it a meeting. You'll have to take notes, which means you discuss the pharmacy. But you can, if you advertise it as a meeting, what, 3 days ahead, 2 days ahead? What is the reasonable? You put it on the calendar, then it'll be a meeting.
You just
You
can't
okay
collude,
then?
you know, the bottom line.
You notified the public there was going to be a meeting over at Weems East of, particularly, the subject would be the pharmacy. Okay? So that's I ain't gonna say that's a get around, that's a legal way to do it. Am I correct? That's it. You call, you get it on the calendar for the hospital, it's advertised as a meeting. But otherwise, I just don't think it's good practice to.
Because that opens it up to the public, you're saying?
Sure, we want the public there, fine.
How
I'd
many
love 'em
days
to.
prior you gotta put that advertisement out?
How many, what,
I'm not sure, I want to say 48 hours.
what,
I want to say 48 hours.
how many hours?
48.
48.
4 days.
2 days, that's simple. That's real simple. And I'd like to meet with everybody there, you know, we'd have a little field trip day one day. So that would be good to do that. All
Well,
right,
certainly that would help you, John, I mean, because
It would.
you don't want to be sitting there all by yourself making these decisions, right?
That's correct.
but the only decision we could make would be on the pharmacy.
Yeah, but
If we-
really.
Well, when you talk about stuff.
Yeah, but really, John, even at that those type of meetings, he's the liaison. He comes back to talk to the board, and the
Yeah.
board makes a decision.
Yeah.
For example, Bill is the liaison to the foundation,
And the finance.
and the finance committee, as well as the what other committee, Bill, that we'll assign you to?
Oh, the Team Franklin.
Team Franklin, right? Bill get the information, he comes back, update the board, and the board makes the decision. So, you know, decisions not being made at the
No.
pharmacy committee meeting, you know, decisions being made by this board. But we want to make sure that you all don't convolute it. You know what I mean? Have these side-by conversations on something you're going to vote for, then you come up and vote on it, then you get,
So who puts this advertisement out there?
well, we can put it out there, yeah.
Can we advertise or put it out there for Weems Pharmacy meeting, 10 a.m. on the 4th of June?
4th
Yeah.
of June, we can do that, yeah. Yeah.
Okay.
4th of June, 10 a.m. in Carabel.
And there'll need to be
Now,
little
also,
minutes taken, the minutes are gonna read, discuss the pharmacy,
Now-
and I don't think that you're gonna vote on it right there.
no, we're not voting on
So
anything
nothing's
there.
gonna be voted on.
Yeah,
so-
now, I think the last meeting we said it was going to be a Teams meeting
Yeah,
instead of an in-person meeting.
Yeah, it could be teamed,
Yeah,
I don't
yeah.
care. It's
And
just
so
I
we-
want everybody involved.
Yeah, we can send a Teams link out to the board members, we can advertise it, you know, really, and put that, say the Teams link is here, then you can jump on there and everybody have the conversation. But when you're talking about voting on anything, that
Comes
you.
back here.
You got, comes back here, and you can't be
Yeah, yeah.
discussing it.
That's
The
the easy way
sidebars.
to do it. That's a real simple way to do it.
Thank you.
Best I understand it. And then, when they have you in court, I'm gonna say,
I don't know nothing.
I don't know nothing.
You gave me direction.
That's the way to do it. You advertise it, and then you're through with it.
We'll talk about those items that we tell, because Sean jumped the agenda, but we'll talk about that.
Okay, next item's the CEO report.
Okay.
Bill, you have anything else? from the
No, that's it.
finance
Thank you.
But this sets a precedent and makes sure that whenever we get into the next phase, which is the ED department, we've got a part procedure or way of doing it.
Yeah.
Yeah, sure.
Yeah.
Yeah, I agree.
So the board action items, you know, we'll talk about it. It's on John's report. We have the pharmacy consultant engagement letter proposed by Blowing Company. And then we have Marvin Heyman that will provide the construction engineering inspection services
Gotta
for
go.
us. That will
Are you
be
ready, Ken?
talked
Go
about
ahead
on,
and do it, it's fine.
that'll be on John's agenda. That's under you, John. So
Oh, I
we,
thought you were doing it now.
no, not yet. I just got on my report letting people know what we're doing.
Well, why you,
It's a part of my report, so I'm just
no
letting.
wonder the meetings are so long.
It's because of me now, right?
Yeah, it ain't because of him at all.
Yeah. All right.
He wants to tromp all over your,
All right. Board information items, you know, we already talked about National Hospital Week, outpatient physical therapy. We talked about that. Oncology program, Jeremy Hogg with Main Street Health is scheduled to attend the June 26th governing board meeting. And he want to give a presentation on the agreement for that. So we need to find out if it's okay to have a executive session with this agreement, if they got proprietary information in there or not. So Jeremy will give me some information to send to Attorney Schuler. The strategic plan meeting begins June 2026. The leadership manager session with Belinda will be next week, June 4th. The governing board session will be June 19th. I'm gonna send out an email. I'm gonna have Crystal tomorrow send out an email to all the governing board members about that June 19th meeting.
The straw.
The June 19th meeting.
Strat.
You all got different pronunciations. Is it?
That's the Jersey accent.
Is it a northerner and a southerner? You know, somebody from Jersey and somebody from the Tampa area that grew up in that area. I don't know. Commissioner Kroon's request, we already spoke about that. The capital improvement grant request, you know, we did submit a grant for ED redesign, also some CT equipment, software upgrades to go into the new CT machine. I have also included in your packets some information about the rural transformation grant update MOU. This document here kind of like tells you what the MOU is about. That's the memorandum of understanding that they're asking all the hospitals to enter into that agreement. Michael Kozar and I will present the MOU at the county commission meeting next Wednesday, and also the line contract may be up on that agenda as well.
But Schuler's looking into something on that, right?
Yeah. Okay, a line gonna be up on the 17th. That's if they hadn't changed it, because Kozar would be there, but, yeah. But Schuler is looking at the MOU. So the MOU really, you got these hospitals with this money, the rural transformation grant money, that's a big, beautiful bill. And a lot of the, you know, they wrote the grant, ACA, really focused on telehealth. And meaning that, you know, it will provide telehealth services for, you know, my biggest thing was cardiology.
Yeah.
You know, then you got stroke care, you got behavioral health care, and they're also doing a tech assessment. So ACA wrote that grant, really focused on a lot on the telehealth part. And so we'll begin to, our particular grant with all these hospitals, that's what we'll begin to focus on as well. Now, this money cannot be given to staff for services, meaning that I cannot hire a cardiologist for this services, which that's what we wanted to do, but we can't do that. It has to be tied into the machine, telehealth.
Tied into what?
The telehealth equipment.
Okay.
Yeah, so it's, you know, when they wrote the grant, I mean, when it came out, when they said, yeah, this is gonna be a boost for rural hospitals, we were all excited.
Yeah.
You know, until you get
And they just narrowed the scope.
near the scope.
By putting it into nothing but phone calls.
Yeah, well, and so, but anyway, this sheet here will tell you more about the scope of the MOU and what we're doing. The 7 hospitals, we have 7 hospitals listed. we got Calhoun Liberty Hospital, Jackson Hospital, Madison County Memorial Hospital, Doc's Memorial in Perry, Doc's Memorial in Bonifay, Northwest Florida Community Hospital, and George E. Weems Memorial Hospital. But one thing is, what this grant is doing is forcing hospitals to work together in partnership, so I think that's good. Next, I have the,
Whoa. What's the heartburn that our county attorney has right now?
well, you have, the thing is that, the heartburn he has is really is that, they're asking the Weems Memorial, which is the county, also to be a part of this. And he just want to make sure we, explain it to the county, that, we want to be a part of this regional partnership, because if you're really not a part of the partnership, it will be hard for you to get the money. ARCA really has pushed that you had to be part of a collaborative, a partnership, really to look favorable on your scores.
So why aren't we?
No, we are. This going to make it more kind of like, it's not formalized in a way, but it's not going to be, it's not obligating you right now. It's just a commitment letter, MOU right now. And then once the money comes, if they get funded, then we're part of that collaborative agreement. We just want to explain it to the county in a way in that area. Secondly, I think this is like I said, it's a good opportunity that hospitals are working together, because really you're leveraging your talent, you're leveraging your dollars here. And then we get to learn from other hospitals what they're doing as well here. Last night, was it last night, Murders? Tuesday night, the senior recognition night?
Tuesday.
Oh, Tuesday night, yeah, okay. Tuesday night, I attended the Franklin County Schools senior recognition night, and our Doug Kramer Healthcare Scholarship went to Nolan Alford. He's a senior at Franklin County School, son of Courtney and Lord Alford. Nolan serves as the senior class president and will graduate today with the highest academic honors, summa cum laude. So he received the Doug Kramer Memorial Healthcare Scholarship. I'm so proud of all those kids. It was amazing, so many young kids we have, that graduated with honors in that particular class. But we've seen a lot of our young people here that are graduating. We have a young man that works for us part-time, at the school. He works for us part-time, but he's a senior at school. He's working in our maintenance department, a young guy. He's graduating today. We have some other people that many of you all know in this community. I know Chris and them probably adopted about 3 kids.
We did. We did.
That we graduated. So I'm just so proud that we're able, to honor Doug's memory. Doug Kramer was the hospital board chairman here, and he died in the beginning of COVID. But he really volunteered many years on this board.
Tell you something about Doug.
Yeah, he was a straight
Doug
shooter.
started the conversation about a pharmacy in Carabel. Doug Kramer did. Because when he mentioned it, I think I was a vice chair or something, I like fell out of my chair, and he said, yeah, I woke Duffy up there with that, didn't I? So Doug started this conversation many years ago.
Yeah, and initially it was going to be a kiosk. Because when I was on the board, we were talking about doing a kiosk. And then we're like, why not look at a pharmacy when the Lion came aboard? So Doug was instrumental. He wanted a pharmacy down in Carabel. But he was a straight shooter, here in the community. So we were honored to do that for the young people there. So, thank you all.
A lot of good teachers and a lot of good parents.
Yeah.
David, you said something out about something we got going on with the school. I didn't really know about it. A learning lab?
Colleen has sent an email to us. We've been partnering with the Franklin County School. They have a health.
That's great.
Yeah, they have a health class, and many times they change the name. But we partner with them for a number of years to go out there and, we have the different people in our ancillary departments. They'll go out there and talk more about, the different services, that we offer. Because most of those kids, they may go into nursing, or they may go into a different kind of field. Louis, and James have been out there to talk about EMS, EMTs. We donated some supplies to them. Now we have a former employee, now is the teacher there, and a very, very good working relationship with them on that. So we've been doing that for a number of years there. I know Colleen did a visit. You want to say something about the visit, Colleen, now?
Yeah, I wasn't personally at the visit, but we just heard back that folks that we know went on a tour, they saw many of the departments, and when they got to the, what's the program called? The Health
Yeah, yeah.
Services Program.
Health lab or something like that?
Yeah, and the folks at the school giving the tour were really grateful for all the partnership that Weems has done with the program at the school in helping to, create awareness and interest in going into healthcare industry for students. So I was not very aware of it myself, but really impressive. And it's another thing that probably the community should be made aware of. We've been doing it for a number of years. It's, it's very important, but there's low awareness. So just lots of little opportunities, I think, to.
It sounds like we need somebody to tighten up on marketing a little bit, just from what I'm hearing.
Yeah, and we have Chrissy Tier, we'll bring her in.
Sounds like she needs to tighten up a little bit.
Yeah,
just saying.
we'll bring in next week, next month, she can give a marketing update on that. But, a lot of things that we do at the hospital, we want to tell our story. We don't tell a
agree.
story on everything we do.
Right.
But this is something that we've been doing, and each year is getting, like last year, since Tara, I didn't mean to call her name, but she's the person over the program, she's a former employee, that has a very great working relationship with us and with Courtney. And so that really, last year, the program really began to flourish. We've always done certain things with them, so.
I just think it speaks to the commitment to the community that people may or may not really be aware of.
Yeah.
So,
Yeah.
missed opportunity, but great stuff.
Thank you.
And that's all I have, Mr. Chairman. We can go to, we got two other things before John can speak.
Is that it?
How many other things?
We got 2 or 3 other things, John, before you can speak. We'll.
You want me to go now?
No, definitely. I think we got
Are
2
you
other
through?
items. I'm through, yeah.
Oh, okay, all right.
I have a question.
Go ahead, John.
The
Shocker.
question is there a policy that, or y'all know about a policy that says you don't bring the helicopters to a location until after EMS gets there? That you have to, EMS has to be there first and request the helicopters to come?
Well, someone has to be there to
Yeah.
assess how critical or traumatic the patient is to see if they need life flight. Does that make sense?
Yeah, it does, but you just lost a lot of time.
Well,
Who's gonna call them?
I
right.
don't know. I'm just asking the.
I mean, you
EMS.
can't, a patient can't call life flight and be like, hey, can you pick me up at the airport? I think I'm bleeding to death. You have to have EMS make that first assessment and make that call, which usually includes the ER doc as well. So they're in communication with whoever our ER doc is at the time, and they decide whether the patient is critical enough to get on that bird. So you have to have that EMS as a middleman. I don't know if that's a Florida law, but there's no other way around it. You have to have that first assessment from a
Well,
paramedic.
we were
to
very fortunate over at Alligator Point recently.
Why?
They had a situation where they needed the helicopter to come in, and they made the call, and the EMS vehicle was coming back across the Ocalaochnee Bridge, coming back into the county. They could just swing down there. So they saved a lot of time. But had they been someplace else,
Yeah,
that time would have been eaten up.
yeah, I understand.
So that, I guess that's a state policy that you would, or
I'm not sure, I'd
somebody's
have to
policy.
research that,
Well,
but
somebody has to make a determination.
Yeah.
There's companies that just gonna do it. Okay.
Learn something new all the time.
Next item is the Carabel Retail Pharmacy update.
No, you got a line in the foundation.
Oh, I'm sorry, Alliant Management Report, I'm sorry. And then I got the foundation. You got anything else?
I don't have anything else to add. I mean, we talked about the strat plan, and
What plan?
that's a big upcoming.
Strategic plan.
And David did mention about the transformation, rural health transformation monies, and I know it's going to be very important. And the timing of this is very important as well. The applications must be filed by June 10th. That's why there is a.
June the 10th?
June the 10th, yep. So it's right around the corner. These are, state-directed guidelines and so forth. And actually, and we're going to work to talk to Attorney Schuler as well to share more around this. But these partnerships is a requirement of this.
You
So
can give money.
not a single hospital can go at it alone. It's a requirement to draw down the money. And again, this is the way it was all drafted up by ACA, who's administering this program. So,
So we need to get this MOU signed.
Yes.
And fast track through the Board of County Commissioners for the next meeting so that we can have this in
It would be
time?
the June 3rd meeting.
Right, so-
You're presented next week to them.
Do you need a board approval on the MOU? That'll come from the county,
Yeah,
right?
I don't think we need a
County.
Because the board already supported us.
Yeah, we support
We're part of
it.
the
Yeah,
partnership
exactly.
already.
Okay.
Okay, with the line, just mention that, I do believe that the county's considering y'all's new contract.
They have,
Correct?
they have, absolutely.
That's in the works right now.
Yeah, that's in the works, and we greatly appreciate, obviously the board here and your support. We I think it's been a great relationship, great partnership. We want to continue to keep serving the community and keep serving the hospital and the board. So, yeah, that should be, as David mentioned, the county commissioners talked about this at the meeting last week, and then either June 3rd or June 17th. I know Attorney Schuler was working on the amendment, the addendum to the existing contract, so no changes. He was working on that, and it was going to be ready to present that.
We want y'all to work 18% harder. with the
Yeah,
new
what's
contract.
Mr. Kosar say? What's he gonna provide extra for this?
18, we want 18% harder work. How's that sound? More productivity by 18%.
What's your skin in the game now? That's the bottom line.
There you go.
18%.
All right, let's move on. The foundation report, Mrs. Esther, whoever, Ms. Esther.
So in an effort not to be incredibly redundant, just some updates. Obviously, Hospital Week was earlier this month. In addition to all the folks that Mr. Walker thanked, wanted to give a special shout out to some of the community partners. Kristen and her husband, tremendously helpful. All the volunteers through the foundation who baked, rolled T-shirts, all of that. Very grateful for them. And then, of course, the team of people. And if I miss anybody, you'll let me know, Melanie. Courtney, Amanda, Melanie, her daughter, Glenda, Craig, and Crystal. We met once a month for several months leading up to it. It was just a really collaborative, great collaboration, and happy to be part of it. Took notes on what went well and what we'll do a little bit differently next year, but was really great. We, the foundation, in partnership with Crystal and Christy Terry, pushed a lot out on social media, and our followers for the foundation doubled in a week's
Wow.
time. So it just, again, it's just another data point showing the more we're communicating with this community through Facebook, majority of people get their information through Facebook.
That's correct.
Right? So many businesses don't even have websites because people don't go there.
I'm
So-
one of them.
So you're right, the personal touch is really important, and then just reminding them, we're here, here's what we're doing, we've always been doing this, maybe you're just not aware, come out and meet the people. So I think Hospital Week was successful on so many levels. Happy to report that currently in progress, we mentioned earlier that we're doing the ribbon cutting with Big Bend Hospice for the hospice suite on June 18th, so that's the day before the Strat meeting. But what we're really proud about is right now we're just literally breaking ground this week on a reflecting garden that we're putting outside the hospice suite and the adjacent room. So our partners at ACE have donated a good amount of beautiful plants and foliage. The foundation has donated things like a polywood bench, a fountain, bird feeder. So Troy and the team and the maintenance team are going to help us make that happen, and it'll be done for the ribbon cutting. So would be great if you all could mark your calendars and please come to that. It's at 4 o'clock on June 18th. So it should be nice. The other day when myself and Bill were over there just mapping it out, a woman walked by us and said, "Oh, you're beautifying the hospital. That's wonderful."
Oh, I think she said it's about time.
I was going to keep that to myself, but she did say it's about time. So I said, make a donation. But that's really exciting. And then, of course, by month, and I know that the clinic beds are now in, so the foundation's really through the generous donations of some of our anonymous donors, we're able to cover half the cost for those very expensive and important beds. So we're proud of that. So thank you to the community. Just other quick updates. Obviously, we have our ongoing donor drive. We're planning's well underway for our one major event. Now it'll be the third year in a row. We're doing our Gala, again, mark your calendars, please. Saturday, November 14th at the Apalachicola Yacht Club. We're looking for volunteers to help us plan and, make that thing happen. We're also looking for donations for a silent auction. More details forthcoming, but.
Will you send something out on that?
I sure
Where
will.
we just-
I sure
instead of
will.
me- I'll lose it if I put it in my notes, but make
No
sure you
problem.
send something out.
Just to reiterate for the public, you can go to the foundation website to purchase
You
tickets,
can-
right?
You can.
Or
our
the Facebook
website.
page.
Yes. We have a page on the hospital website. We're on Facebook, and we're posting multiple times a month. We try to at least be out there once a week, so there's not fatigue as we approach the event, but things are well underway. A couple other things just to note. Talking with Courtney and Amanda, we are going to be looking at some key, we'll call them milestones per month. Again, seeing how great it was for the community and the team at the hospital for Hospital Week. We don't want it to just be a 1 week pops up. So what's something we can do each month just to kind of bring the team together, engage the community. So more to follow on that. We are going to be present at the July 3rd waterfront again. Our presence, the foundation, will be a little bit just more community engagement, but we're again working with the vendor who basically donates a good portion of the proceeds they make by selling the lemonade back to the foundation. So we're doing that, sharing the sponsorship with the hospital. And then just brainstorming underway on 2 potential additional fundraisers. One in the fall, perhaps a car show. Myself and my friend on the board there, we're going to put our heads together and figure out how we do that in the fall. And then potentially, just hot off the press, maybe something bigger in the spring, something along the lines of a golf outing. So more to follow. But again, looking for any interested parties who want to join the planning team or volunteer in any way, they can just reach out to me. That's it.
No Teslas are allowed. This
No.
is antique cars.
Yeah, we will not have
Walker.
any electric outlets for you, so. Any questions? No?
You do good work, ma'am. Thank
Oh,
you so much.
thank you for your
Thank you.
partnership.
We're incredibly lucky to have you.
Thank,
Colleen and Colleen's husband.
That guy, that's that guy there.
Great job, really appreciate it.
Yeah.
Visibility,
yeah.
from Colleen, and I was talking to somebody at the meeting yesterday about joining the foundation. And of course, they can't keep going right now because they're involved in something else. I talked to guys, but we have to people have something along those lines. But anyway, Colleen's doing a great job, great visibility, we greatly appreciate her and Colleen's husband.
And thank you for all your partnership, I appreciate it.
That guy right there. Number
That
2.
guy.
Number 2. All right. Next item is the Carabel Retail Pharmacy update. John?
Okay.
Wake them up.
No, I'm awake. Now, I know y'all are going to applaud, but June the 18th through the 23rd, I'll be in Virginia.
Okay.
Okay, that's during your strap meeting and a couple other things, okay?
You'll get interviewed, we'll make sure you get interviewed by November.
If you have Zoom available that works, I'll do it from there. All right, as far as the pharmacy is concerned, and thank you. I want all of y'all to be a part of this. That's why I raised the question earlier, okay? About our participation. You should have I didn't look at the packet yet, but Marvin Heyman, I guess some of y'all know Marvin. He's an architect over on Alligator Point. He has provided pro bono services to us for all the architectural work, which is the key for the beginning of doing this thing, this project. We should have a letter here that has to be approved, if I'm not mistaken, right, David, for that?
No, we don't have to be approved for that.
You could approve that? Okay. Let them know what the amount was and everything like that.
It's pro bono, and I don't need approval, but I'm gonna pass this down so y'all can take a look at the letter that I sent Marvin.
While y'all looking at that, the second thing is that Marvin, being the architect, and he's provided us a CEI services contract, which is the construction engineering and inspection. Now, that's really key because he did the plans, but he has to work with, and the driver of that side of the equation is going to be Craig, okay? Craig is going to be the hospital's representative during the construction of what has to take place. So Blue has come along and offered you another contract, what, 32,000, something like that, for their services. There's a myriad of different type of services that they're offering. I think the key thing is that they are offering to help Marvin with the layout of the facility and the cabinets and the alarms, so forth like that. And then the real key is they're going to tell us what has to be stocked and the cost of that, okay? That, if I understood it correctly, and David, please jump in if I'm wrong. They are in the process right now of looking at Marvin's information as his really second time drawings, and giving him feedback, and hopefully this coming week we'll be able to sit down and say, yeah, that looks good, and go forward. The next step after that is to put out an RFP. And our RFQ or RFI, I'm not sure which one it is, but that is to pass that to the community and advertise for construction services. Hopefully it's somebody that's done it before, local, and we get a price at that point as to what this thing is really going to cost us. We should already know the prescription amount. And the time after that, we'll know what the time frame is.
Could I ask a question?
Sure.
Are we going to bundle that up as one contract, or are we going to break it up for the cabinets, for this, for that?
Good question. I would think you're going to wind up paying a middleman to come do all that. And I would think between Blue and Marvin, they would be able to pick out what Blue is saying. I think Blue already has a list of vendors, if I'm not mistaken, that provide these cabinets and so forth.
Okay.
In fact, they did tell me that.
Okay.
So I think that will be covered. If it's not, we'll have to do what's necessary. But a key factor in this is going to be, once we decide that's the plan we want, this is the way we want it, and everybody signs off on it, then we got to give that to somebody. And Marvin will be the first one to do it, price it out.
Okay.
So we get a handle on this construction, and it doesn't get away from us at any point. I think that's about it.
That's about it. I just want to so what John mentioned is, we have two action items for you all. We have Marvin Heyman's proposal to do the construction engineering inspection portion of this project. Then we have the Blue and Company proposal. And so the Blue and Company proposal, Attorney Schuler has some revisions, and so Blue and Company is reviewing that. So I'd like to approve both of these with the Blue and Company based pending Attorney Schuler's
Review, yeah.
Legal review. And so let's go ahead and approve both of these items, and then we'll put this one, Blue and Company pending Attorney Schuler's review. That way we can continue to move the project forward.
Okay.
Is Blue and Company going to do the whole thing like the automatic, let us know who we need to, like your prescriptions due and all that stuff on the, are they going to be involved in?
That's software subscription stuff.
That's the software.
Yeah.
Right.
Yeah, so you're gonna have all of that.
Okay.
You can do the program out. And another thing too, if there's anything, and of course Deputy mentioned this, if there's anything that the board, what we're seeing that we need a board vote on to keep the project moving, we may call a special meeting just for the pharmacy.
Yeah, I just do not want this to be delayed because of us.
Right.
And you got a gap in there if it's something also the county needs to do. We need to go ahead and meet. Now, we're gonna need a quorum. We might meet at 6 o'clock one evening. I'm not sure, 4 o'clock, whatever we get the enough people here, but we can't delay that at all. So the first item is Marvin's. Do I have
Make
a
a
motion?
motion to approve Marvin Hayman's,
Do I have a second?
Second.
Is there any discussion? I know Marvin, I got a lot of confidence in him, too.
The only thing is, one question is, did we need a construction manager of some kind? Or, I know we talked at one point, Marvin picking up that other hat and doing that for us.
that's the CEI side of it.
Right.
But Craig is going to be.
He's going to be the
key.
CEI.
Yeah.
Well, because
No.
Marvin's contract, in the CEI contract, his trips, he doesn't know how many trips he has, but he gave you a trip cost
Right.
in his contract. So that can be reduced, even in Marvin's words, can be reduced by Craig being involved and not having to call Marvin every, but come over all the time.
Right.
All right? So I thought that was a good approach because
Good approach.
Craig's had his hands in all this stuff before.
Right.
Craig's had a lot bigger projects than this.
Yes.
Craig's had a lot bigger, this is a small project for Craig.
Anything that's dealing with the hospital.
Plan. Anything to do with the plan,
Okay,
so.
any discussion on that? All in favor? Aye.
Aye.
All opposed? No. Next item. You had two items, you said.
Blue and Company, engagement letter pending return to school review.
Now, does that have to go to the county, or that's just us?
No, it's us. It's just return to school review.
Make a motion to approve.
Second.
I got some discussion. You've dealt with Blue and Company? Have you?
What's
Have
the
you had any
relationship?
experience building a pharmacy or starting a pharmacy?
Well, that's your sister company, isn't it?
Yeah, we work with them now on the
I know we
340B
work with them
program.
now,
Yeah.
but have you had firsthand experience with David?
Which David?
Which David?
David, excuse me.
David B
Yeah,
or
sir.
or W?
Yeah, certainly, yeah, I mean.
The
and
DD
Jay-
team.
And you guys have met,
team.
The
you
DD
guys have
team.
met
Yeah, we met him,
Jason.
we met him.
Yeah, I mean, and he's a pharmacist. I mean,
Right.
a PharmD, and so is Alyssa's a PharmD. I mean, this is what they do.
Exactly.
This is what they specialize in. You know, Blue and Company is a CPA firm.
Right.
However, but this is a specific division that provides pharmacy services.
Okay.
And
That's
so
fine.
they have an operational playbook. They have started up many retail pharmacies. I mean, this is, quite frankly, this is what they do.
Right, they
Along
know the
with along with
legalities.
340B
They know all-
programs.
Do all the
are they gonna help
legalities,
with-
what we have to
Are they
do.
gonna
That's
help with
correct.
permitting too?
With the licenses.
Permitting and
Let me,
stuff?
let me just mention this too. We use Blue and Company for our 340B program. We have one of the highest ratings or audits with HRSA on that. And so I got confidence in them, with working with us on this project, to get this project moving along, because like David said, this is what they do. I think, we're in a good place just to get the project going, and I think we're gonna see some fruit.
Okay, good.
There's one
Any
other
further
thing.
discussion?
Yes. Can we have the corporate structure, isn't it Blue is the parent?
Blue's not the parent. There are partners within Blue who have direct,
Okay, who is the parent of Alliant?
yeah, it's referenced as Blue Management Services, which is partners of Blue. So it's not.
Blue Management
That's
Services
correct.
is what to Blue?
It is a group of partners who are affiliated with Blue.
I don't
It's
understand.
partners, it's current partners and retired partners of Blue and Co., who have ownership into Blue Management Services, who ultimately owns Alliant Management Services.
So that's what I wanted to hear and y'all understand.
Yeah.
It's the group of partners, both active and inactive, retired, that own Blue Management Company.
That's correct.
Blue Management Company owns Alliant.
Right.
correct.
That's
Okay.
why I called it a sister
So-
company, but
That's right. That's right.
It's in their interest, they've got basically a divided interest, in my opinion. That is, one, they want to sell as most drugs they can so they can get their rebates, okay? I don't know what percentage is peeled off for that, but the second thing is, I wanted everybody on the board to understand the arm's length, or lack of arm's length relationship, okay?
Sure.
It's all in Alliant.
They have
Alliant's
incentive,
bigger.
they have good incentive to make it successful.
Yeah, because we could take it out on Alliant.
Yeah, I know. So,
Absolutely.
take it out. You're rugged, John.
100% confidence in those guys. I
Well,
mean,
isn't that the
Okay.
bottom line?
All approved, no.
All in favor?
I need a motion.
We got the motion second, now we did the
No more
discussion.
discussion? All in favor?
Aye.
All opposed? Go ahead on. Anything else?
That was painful.
Okay, I got a question about what date we told the commission this is 10 to 12 month project, right? Is that what we told them?
Yep, 12 months.
What date what date did we tell them that?
A month ago?
Okay, I'll go with that.
But don't hold our feet to the fire. We're gonna go hard if we can bring it in 10
No,
months.
this is our little thing, April 28th.
Don't tell anybody.
No, we're telling everybody. I ain't telling nobody, this is ours. I'm gonna have that on the agenda every time. 12 months from April 28th will be April 28th of the next year. I'd like to get into that, but I just think you need to have a target date.
Got
We
it.
gotta have a target date. So let's make that, February 28th.
When?
February 28th. That's target date. We got 60 days, plus 60.
Well, April 28th, April 28th, 2026, April 28th, 2027 is 12 months.
Right.
April to April.
We said 9 to 12, right?
That's right.
April to April.
Give me a target date, y'all. John, what do you feel good
April
with
to
a target
April,
date?
a year.
I
That
feel
gives us a
good
little
with
wiggle
Probably
room.
10 to 12 months between now and.
Okay, we're gonna talk about that every time, see how we do it. You need a target date, right?
Right,
Something.
well, we're gonna have a schedule.
You'll have a schedule. I
Darn
figured that.
right.
I knew that.
I like April 1st. That's-
No, let's don't do that. All right. Anything else with the farm? Hey, this pharmacy is a wonderful thing, I think. It's absolutely. John, let me ask you right quick. Well, you said probably people in Alligator Point will come to Carabel instead of maybe.
All the way to, yeah.
You know.
If it's available and we've got the service,
We're gonna have it.
and of course Susie wants to drive it to Alligator Point, so.
You know, Chairman, what I'd recommend too is once we move forward with these engagements and John's leading this, you know, from a board standpoint, we'll bring the timeline every month
Yeah.
to this
Project
meeting, to
schedule.
this meeting, project schedule, and that's part of the playbook that Blue will help as well, but we'll have the timelines.
Let's
and we'll
get
keep
Blue in the
we'll keep the
equation, let them know what
community
we're
updated.
shooting for. Because I've seen these things, if you don't make yourself do something, it might not happen. And
I know,
John,
but
the board will not hinder you in any way.
I've been on their case, don't worry.
I'm talking about this board,
Oh,
and I don't
That's
think the
your
county
job.
will either. I can speak personally, this board.
With the end, you look at, land stations, but other than that, then you should be able to get in and start moving kind of right along what you want to do. Just like anything else, with the things that hold you up is inspections, state inspections, things like that. But
Just don't let it hold us up.
Well, John recommended for your committee, have some milestone targets
Yeah, he probably will.
down.
We are.
They will.
Down the road, so this date, we're gonna get certain amount done, next date, we're gonna get certain amount done by that, so keep the subcontractors, contractors in line, right?
All right, we got anything else? If not, meeting adjourned.